Good afternoon, everybody. Well, my camera is not so clear. Let me try to improve my lights. Yeah, just for some minutes because we need to talk about it. This is our first workshop in this group, so we start in 5 minutes. So I might stay here, and well, we have a lot of things to do. I mean, so I'll be back as soon as my first student gets into. Okay, so patience. Okay, it's 6:30. The schedule we decided to start with this workshop. So let's wait. I'll be back with my first student. Following the role is Neil Aviles. Yes, let's wait a little bit. I'll be back as soon as he gets in. Good afternoon, Neil. Can you hear me? I cannot hear you.
Okay.
Well,
I can see you, I hear you. Good evening.
Good evening. Well, good afternoon. At this point, you are still on afternoon, right?
Yes, yes.
Perfect. Nice to meet you.
Nice to meet you too. You prefer to call it Iris or Roxanne?
That's the same for me.
Okay.
So tell me, let's talk about yourself a little bit. Let me know about you. Yesterday, I made my introduction myself. I introduced myself. Okay, now it's your turn.
My name is Nila Viles. I'm a dentist. I was busy all day, so I can study a lot your presentation the last night. But I don't know what else you.
Okay, let me ask you something. You're a dentist. That's perfect. That's a good point of view because you're a healthcare provider. During this course, well, actually, this is prepared for doctors because we take into account lots of anatomical landmarks and ways about writing down for doctors just. But it doesn't mean that you cannot work on this. Of course, there are small differences that we can fix for you specifically, and according to that, it's going to be easier to get homework or to complete the topics we have already prepared. Okay.
Okay, it's not a problem.
Perfect. If something is not so according, I mean, it's not following your objectives according to your career, let me know in order to improve this or not taking a course as if you were a doctor just. Okay.
Okay, no problem.
I really need to know this because, well, all the courses, I have students from first or second year on the medical career, and they are out of mind. It's not easy to catch all the meanings, all the vocabulary, or the context we are talking about. In your case, it's not going to be the same, of course, because you are into this healthcare provider world, we can say.
No problem. The context I understand as well as possible.
Yes, yesterday was an easy, very easy presentation, a very general view of many things with many general anatomical references, I mean. But next ones are, well, start focusing on specific systems, some diseases, explaining vocabulary or expressions that are showing us ways to use the new vocabulary. But that's not a problem. The previous course, I had a translator, someone who is out of the medical career, and she was one of my best students. So it's possible to make it, I mean, okay?
Yes, no problem at all.
That's perfect.
Yeah. So, what can I say you now?
Yeah, okay, just reading, catching the slides. It's going to be easy to catch the basic information. I'm repeating these basics, just the basics, because when I was at college, at the university, I had the chance to receive the medical English course for around 5 years. And it's not the same to study 5 years than to study in 2 months. We have to be clear on this point. So we are going to check the most general and the most important parts for all of the purposes we have at this moment. I like to send homework, like writing down paragraphs by yourself, using some topics and following guidelines, or for example, making the case report, how to start doing the clinical history. That is similar in your career.
Yeah. It's similar, yes.
Yes, in that order, the clinical case, the clinical situation is going to be focused on your career, okay?
Okay.
It's going to be easier for you. It's going to be nice, I think, and we can fix it. There's no problem. Moreover, I think tonight I can send a dictionary for translating medical terms from English to Spanish, and it's going to be helpful for the whole group. And, well, that's all from me, yeah.
Yeah, it's no problem. Usually I can speak in English almost 7 years ago. So for me, it's a big issue to speak something.
Don't worry about it. If you need me to speak slower or tell you in a different way, an expression or maybe a ganja, let me know about it. We can fix it, okay?
Okay.
That's important. You were telling me that you didn't have enough time to check the slides, right?
Yes.
Okay, don't worry about it.
I start almost 6 o'clock.
Okay,
But
that's good enough. Yes, you really need more time. Don't worry about it. About homework, I usually send just one file every week. I mean, we have 2 theoretical presentations, right?
yes.
I have some files prepared taking the theoretical classes information in a file with full exercises, labeling, I don't know, some anatomical references, and complete the filling blanks. Details like that's very nice, very easy. You don't realize it's a long job, but everything is coming from the slides. So that's a way to study on this.
Yes.
Every workshop, we have the chance to talk again, to make a feedback from the slides you need. So don't worry, if you didn't have time today because you were working, you can check all the information until Thursday, and then we can talk about it on Thursday.
Okay.
Just only don't try to accumulate too much information to only just one workshop, because 15 minutes, it's not enough.
Yes.
And on the other hand, yesterday was a short presentation. Tomorrow we have 65 slides, if my memory is not getting lost. 65 slides to check with useful information. So as you can see, it's bigger. This model 1 has long presentations, but I'm trying to correct some details in order to make them a little bit smaller, just going to the point, making it easier to catch the details we need. Okay?
Okay, no problem. I was writing in my...
Perfect. On your notebook, right?
In my notebook, a few questions to read later, because
Okay.
I was a meeting 7:30 to 10:30.
Yes, you
That's
have
why
minutes more.
I asked you switch earlier this meeting.
Yes. Is now this schedule is okay for you, right? Because if you think it's okay, we can stand here the whole course, the whole module 1.
Okay, it's perfect for me.
Perfect, because I take it in count. If you have to work or you're with a patient with an emergency, let me know by a message for not changing your schedule and trying to stay here, okay?
Okay. I think a lot.
Yes, it's useful for you. That's okay for me.
Okay, see, yes, because I'm going to downtown.
Okay.
And it's a rush hour.
Wow, where are you working now?
Right now I'm in Villa Fatima.
Okay.
So it's
There's a lot of
downtown my meeting, and the, how can I say, embotellamiento?
the traffic.
The traffic is heavy.
Yes, it's awful at this time.
Yes.
Yeah, but well, that's your job. I'm sending you the pool for taking attendance, okay? Can you watch this?
Yes.
Okay.
It's
It's the same as yesterday.
yes.
Every class we have to fill this.
Okay.
Like that you were present, okay?
Okay.
Let's do this. In order that you didn't have enough time to check all the slides, all the information we were talking about yesterday, finish reading them, okay, the slides. And all the questions you have.
I finished it. They read all the slides.
Yeah.
That's why I was writing in my notebook.
Yeah. But
the most important things.
Okay, the most important details.
But I learned
to me by WhatsApp.
And all the parts of later. Body.
Okay, about parts of the body, you were telling me. Do you need the presentation opened? I can share the screen.
No, it's okay. But that's a lot of information and vocabulary. It's bigger.
Okay. So send me by WhatsApp if you consider that it could be useful for you. And we
Okay.
can solve the doubts by this way because we are almost on time.
Okay.
At this point, they're supposed to get into, okay, here is your colleague, your classmate.
Okay.
So Neil, nice to see you.
Nice to see you.
To start working with you. So send me by a message by WhatsApp, and according to that, I'm going to answer you, okay?
Okay. Okay. Thanks a lot. Take
Oh,
care.
okay, you too. Have a great
See you
night.
tomorrow.
See you tomorrow.
Bye-bye.
Bye. Good afternoon, Diego.
Hi, teacher. Good afternoon.
Hi, how are you? How was your day?
Yeah, it was really good. I already arrived at my home. I was hanging out with my friends. We were eating an ice cream.
Oh, perfect.
Yeah.
You had a fun day. That's perfect. A fun activity.
Yeah. Yeah. Yeah,
That's
teacher.
great.
Do I need to turn on my camera?
Yes, it would be useful now for start meeting each other.
Okay.
It's the first time we talk, right?
Yeah, teacher.
Okay, let me see. Yesterday I introduced myself. Now it's your turn. Let me know something about you.
No, okay, teacher. Well, my name is Diego Garron Cruz. I'm 24 years old. I just graduated from medical school here in La Paz, Bolivia. And well, now. Sorry, teacher. I couldn't hear you.
We are doctors.
Yeah. We're colleagues now, but no, with zero experience in my case. But well, I'm doing my best.
You finished the internship. You finished the medical career. You are a colleague. Don't try to make less yourself. That's great. You're just graduated, but you're important at this point.
Yeah, thank you, teacher. Yeah. So, well, no, I think that in this time that I'm waiting for my papers to be completed, I'm searching for making, I don't know, something like in the meantime. And I saw this course that is, I don't know, like in the direction I'm looking for. It's to practice the medical school, right? Because I already finished the CBA here when I was at school, but well, that's an English, social English, and I was
common English. It's done, so we can talk in the same level. So
yeah. Well, I don't know,
and that's perfect to me.
I don't know if I'm doing it well. I don't know if my fluency is already good, but because I didn't practice, I don't know, a lot, but I hope that something that in the past I was good, it's here.
We are from the CBA. We are from the we have many things in common, so don't worry about it.
Okay. That's good.
No, that's nice to meet you. So
nice to meet you too, teacher.
Did you have the chance to check the slides?
Yeah. I checked them at early this morning, and I could read them in a very slow, more way, but yeah, I couldn't.
Perfect. Any question about them? Maybe detail to check again.
Well, I think that the most difficult part for me was knowing the difference between the illness and sickness, because there were for me really similar in the way that maybe how a patient is going to approach to me and say me how does he or she feels, and maybe how can I know that, right?
Yes, how they get this information to you, how they tell you this speech, right?
Yeah.
It's not easy to catch the meaning at the first step, because in Spanish it's so easy. Tú estás sano o enfermo, right?
Yes. Yeah.
In Spanish we have only one term, but in English we have this difference: sickness, illness, and disease. And why this is a practical way to classify how people feel in order to understand, we can say, how difficult could be the situation.
Okay.
In that way, sickness is something that you know is something easy to recover. For example, a flu. If you got a flu, do you go to the doctor?
Well, I think I would not go, not yet.
Okay, you wouldn't because you're a doctor, but if you have a common flu,
Oh
something
yeah,
easy to
yeah,
control, you know that taking, I don't know, a Tapsin, you're gonna feel better.
yes.
You don't
Yes.
go to the doctor. You don't really need to go because you feel that something is not too bad at this moment. And taking a pill, taking some hot tea, you're gonna be nice, right?
Okay.
That's
Okay.
a sick, to feel sick, I mean.
So in that case, if I can, I don't know how to say it, get it, is like if a patient is going to feel sick, maybe in a high percentage, is not going to come to me, right?
No, well, when people feel sick, but they are really sick, they don't go to you by any
Ah,
reason.
yeah. Okay.
For
Okay.
example, if you are cooking and you get a cut on your finger, do you go to the doctor for an easy
Yeah.
cut?
Yeah. Okay. Okay.
That could be compared with a sickness, okay? Something that
Okay.
you can control by your own without taking a long treatment, antibiotics, or something that must be prescribed by a doctor.
Okay, teacher.
That's a
Okay.
sickness. It's a social dysfunction, yes, because you are not well, you are not healthy,
Mhm.
but you think that it's not a big problem. You feel you can control it by your own.
Okay. Okay.
On the other hand, we have the illness. So in order, I was telling you yesterday, when you recognize you have an illness, you feel worst, you know something is going wrong, you know that you cannot control it by your own at home. You try at the beginning, but then you notice that it's not possible to do it. You say, "Oh, something is going bad, so I prefer to go to the doctor." And usually you go to the emergency room, right?
Yeah. Yeah. And it's a bad moment for the interns.
Yes, it's a bad moment for everybody. I was working
Yeah.
at the emergency department in a big hospital,
Yeah.
so I really know how it works.
Yeah.
Goes
Yeah.
to the emergency room, no matter the situation, and everybody has to be the first one to be assisted, right?
Yes. Yes, teacher.
So in that way, when you have an illness, your life is not on risk. There are no complications that can make you feel so bad, right? You receive a diagnosis, you receive a treatment, and according to that treatment, you
Okay.
recover completely without any consequence.
Okay, teacher.
For example, in a gastroenteritis, the easiest example, or a urinary tract infection, an easy one, right?
Okay. Yeah.
You take your antibiotics, you take some pills, you take rest. Maybe you don't go for work in 2 or 3 days, who knows, according to the situation. You
Yes.
recover, you feel better, you finish your treatment, you go to the control to the doctor, and the doctor says everything is okay, you recovered, thank you, continue with your life, right?
Okay, teacher. Yeah.
That's an illness. You have no consequences. Okay?
Okay. Okay.
In a disease, it's a situation when something is wrong in the body function. I mean, the physiology is working bad.
Okay.
For
But
example, yes,
sorry,
for
teacher.
example, in a diabetes, diabetes has a cure.
No, it's only you need to be in treatment
Yes, treatment for the rest of your life,
for the
right?
rest of life. Yeah. Yeah. Okay. Yes.
You need to take pills or maybe shots according to the situation every day. And if you don't take them, the situation is going wrong, and physiological and psychological dysfunction is gonna be so easy to catch, I mean, right?
Okay. Okay.
That's a disease. It's a situation when you really don't have a solution. It's a chronic situation, we can say.
Okay. Oh, the rule is that it doesn't have a solution.
A solution. That's a disease.
And in
For
this,
example, yeah,
sorry,
tell me,
teacher, yeah.
tell me, I can hear you.
And in this case, a disease it only can be known as a disease if a doctor says. I
Yes,
mean, if
we
we
need
get
the opinion and evaluation from an expert. Could be a specialist,
okay.
could be a group of research, who knows? But we need
Okay.
an,
Okay.
an opinion that is supporting this situation by studies, lab studies, image studies, I don't know. According to the situation, you know if it's a disease or not. With an
No.
illness, sometimes just with the physical evaluation, we know that something's wrong. With a pharyngitis, for example, it's an illness, right?
Yes.
The pharyngitis, do you really need to make some cultures, to take some labs to get the diagnosis this pharyngitis?
I don't think so, teacher.
Of course, no, you don't really need that. If they are in repeated occasions, maybe culture. But if it's the first time it's according to the weather, you don't really need lab tests to solve this situation with treatment. That's an illness. With a disease, you really need to take lab tests, imaging tests, I don't know, all the protocol that is prepared for these situations. In a diabetes, if you don't have the blood sugar control in the steps you really need them, it's not possible to get in suspect, right?
Yeah.
It's not just one take. You need at least still 3 labs of this and then looking for complications of diabetes, right?
Yeah. Okay. Yeah. I think now it's like 4, no? 4 things you must achieve to make the disease.
Yes, you have to attach that lab
Attach.
tests in your report, your medical report, in order to support your medical thought, your diagnosis.
Diagnosis. Yes. Yes, teacher.
In that order, a disease has no solution.
Okay. Okay. Now I get it better.
It's a chronic situation.
Okay.
COVID-19 is an illness or a disease?
Yeah, an illness.
Why?
Because it's I don't know, it's a virus that it's temporarily affecting the body, the physiology of the body, but after a certain time we recover, we fully recover.
Perfect. But what about the consequences it leaves? For example, the loss of taste.
Well, yeah. I have read that in some cases people lose a certain capacity of smelling, no things. Yeah,
yes,
yeah,
you
it
could
could be
lose the smell, taste. You
taste.
could lose the finest coordination. You could continue with chronic pain, right? Chronic pain. According to the consequence, you could say if it's an illness or a disease, but you have to make the difference if there is no a consequence.
Okay.
Okay. According to the situation, you decide if it's an illness or disease. That's why it's a very dynamic concept, a very dynamic idea to talk about illness and disease.
Yeah,
easy.
yeah,
Nobody takes it count.
Yeah. In that way, yeah, teacher, like you saying, yeah, it could be the both things, right? Also,
Yes.
What
about tuberculosis?
Excuse me?
What about tuberculosis? It's an illness or a disease?
Well, it could be, I don't know, maybe in both cases too, because if we treat it at a sooner time, and I think it's not going to have consequences later on the patient.
Yes, the patient has all the resources for taking the treatment, making diet, improving his lifestyle, of course. It's going to be an illness.
It's going, yeah, exactly. Yeah.
Okay, perfect. So now you catch the idea, right?
Yeah, now I get it better, teacher. Thank you so much.
Perfect. Now it's clear, because when we talk about illness and disease in the medical context, it's according to the situation. According to the protocol you are following in the way to evaluate the patient, you have the chance to decide if he's suffering illness or a disease. For example, if you have a patient in the intensive care unit, is with an illness or a disease?
Well, no, I think in that case it's already a disease, only because the idea that he's in a really bad state, I think.
In a really bad situation, right?
Yeah.
Yes, you are right. Every patient that gets into the intensive care unit is with a disease, no matter the diagnosis, because the physiological and psychological dysfunction is remarkable. It's very important. In that way,
teacher.
if your patient, for example, goes with a pneumonia to get mechanic ventilation, of course, it's a disease. It can be recovered, yes, but all the patients I treated with these situations, for example, where in mechanical ventilations has a consequence for the rest of their life.
Yeah.
So
I'm
that's why
thinking
it's
that
considered a disease. Pneumonia could leave you some consequences, right? Of course,
yes, teacher.
So according to that, you can say it's a disease. It's easy to make, right? Easy to catch the idea.
No. Now it's a bit easier. You explaining it to me, teacher. Thanks so much.
Perfect. With practice, you're going to catch more details, and that's going to be easier. While reading articles, you're going to catch the difference easier and catch the real meaning of what you are reading.
Okay, teacher.
It's going to be useful to get this difference very clear about illness and disease. That's why it's important to consider this. First time when I read this, I almost get mad because I said, how can I explain this to my students?
Yeah.
It's a very abstract idea, and
I can imagine it. Yeah, it's so similar. I think illness and sickness, they are so similar.
Yeah, so similar. Yes. When you read it the first time, it's very similar. You say, which one is the difference?
Yeah,
Looking
exactly.
to this, you catch the meaning and easy to make, right?
Yes, teacher.
What about this? Some patients are going to tell you, I feel sick, in the way we were talking yesterday, right?
Yes.
Usually they when people tell you, I feel sick, they're talking about nausea and vomiting.
Yeah, I didn't know that the sickness could mean the same, like nausea and vomiting.
No,
I only thought it was only.
That's the common meaning. That's the common one. They say, I feel sick. You can infer that they feel nausea and vomiting. Or maybe you can ask what kind of sickness you're feeling at the moment. And they can tell you, I'm with the sleeping sickness. It's for Legos, for people who's not in the medical career. Now, sleeping sickness is not correct. The term is sleeping disorders, the correct term.
Okay, teacher.
The travel sickness, for example, the traveler diarrhea is a travel sickness.
Okay.
Or the attitude non-adaptation syndrome is a travel sickness too.
Okay.
Yeah.
Okay, teacher. Now I get it.
It's a travel sickness. So if they tell you travel sickness, just think on this: nausea and vomiting at the first step. Okay.
Okay, teacher. Okay.
Well, these terms are easy to make, but you have to infer a lot. I have to ask a lot about these expressions that patients, but they really tells you this. I feel sick. Okay, and they think that you have the power to catch the idea and understand it. No, it's not happening in that way.
Okay.
Here in La Paz, we have 2 hospitals who work with travelers that only speak in English. We have 2 hospitals.
I didn't know. Which one are those, teacher?
The best for me is the Clínica Alemana. They receive travelers from all over the world. You have to speak in English in order to not getting mad with them, or you have to talk to the translators, that usually translators speak just in English and the language of the traveler, not Spanish. And the other clinic that works in that way is the Clínica Lausanne in frente a los sargentos.
Okay, okay.
En bajo ir papi, no, no es ir papi. Bajo según coma.
Okay. Yeah.
Yeah, Clínica
Okay.
Lausanne. This space only works, only assists travelers. And you speak just in English. That's why you hear these expressions and you get mad. You said, what?
Yeah. I can imagine it. Yeah,
Yeah.
teacher.
So in those spaces, you have the chance to practice and improve these kind of expressions and lots of ganchas. I'm sending you, Diego, the tool to take attendance, okay?
Thank you, teacher. Yeah, I'm seeing it right now in my screen. Yeah, let me fill it. 2 seconds.
Okay,
mm,
fill this,
mm.
and that's all. I didn't check the hour. Okay, Diego.
Yeah. Sorry. Yeah, I think I take 5 minutes from the other student. Sorry.
Yeah, don't worry. Hi, Carla.
Okay, bye.
Carla is here. Well, Diego, so see you tomorrow in the
Hi,
theoretical
teacher.
class. If there are more questions, send me a message by WhatsApp, okay?
Okay, teacher. Thank you.
Okay, bye-bye.
Bye, teacher.
Bye. Hi, Carla. How was your day?
Hi, teacher.
Nice to meet you, Carla. That's great.
Sorry, I couldn't hear you.
Oops, now can you hear me clearly? I'm improving my...
Yes,
Perfect. How was your day?
it was
Everything-
okay. Thank you, teacher.
Perfect. Okay, yesterday I introduced myself. Now it's your turn. Let me meet you a little bit.
Okay. My name is Carla Alvarez. I'm 24 years old. I'm from La Paz, Bolivia. I just graduated this year.
Okay, you are a general practitioner.
Sorry?
You're a general practitioner, médico general.
Yes.
Perfect. We are colleagues, so
Yes, we are.
perfect. That's great because at this moment I don't have students. Yes, yeah. Medical student. And it's different to talk with a colleague than talking with a medical student from first or second year.
Yes.
You have
Yes,
the
I
meaning
think-
of, but you have all the knowledge we need for making this course, and that's important.
Yeah. Yeah, I think we have the basis.
Yes, you have the basis, you have a good English level in the way we're talking now, and that's the best part.
Yes.
Okay, are you working now? Are you, I don't know, preparing your, I don't know.
Well, I'm studying for the medical residency, and I'm working with some doctors. I'm going to some surgeries and helping like that.
Okay, you're the second surgeon, so
Yes.
perfect. That's a good way of working to start doing your job, to keep on duty and not missing the contacts, right?
Yes. Just for not forgetting some things in surgery, for example, the practice.
Yes. Yes, it's important not to lose that kind of work.
Yes.
Perfect. So you are preparing to the medical residency course, right? You were telling me that. Which specialty you are following?
I would like to be a gynecology obstetrician.
Wow, so brave.
Yes, I think so.
Yeah, so brave because there are critical situations in gynecology. Well, in the obstetrics, I mean, it's harder, but no, they are not for me.
Yes, I think it's more difficult because of the social life.
Yes.
Because it's, I think, kind of 24 hours work.
Yes. You don't have a time to relax or to spread by yourself, right?
Yes.
Yeah, don't worry. If you like it, welcome. Well done. Don't worry about it.
I guess.
Perfect. Well, dear, in the order you are with time, huh? Yeah. Tell me, did you have the chance to check the slides from yesterday?
Yes, I did.
Perfect. Any question about them? Something to point to check again?
No, I don't think I have any question.
Okay.
I
Yeah.
think everything was clear.
Yes, they are easy to catch at this point, right?
Yes.
But let me see. I was talking to your colleague, to Diego,
Mhm.
about the difference in meaning of illness, sickness, and disease. Did you
Mhm.
catch the meaning of these terms?
Yes, I think I did.
Okay, explain to me. We have 5
Okay.
minutes.
Okay. Well, I catch the idea that illness is like when you I don't know, when you feel sick, when you are not feeling well, not healthy, and you need to go to the doctor, but you don't have any consequences. I mean, it's like um, um, that you are unhealthy, but you're going to fully recover.
Okay.
And sickness, it's when you don't need to go to the doctor, you don't need to visit them to take any specific medication.
Okay. What about disease?
Disease is more complicated. It's when you are not feeling well, but you need to go to a specialist
Could be.
and I don't know, take specific medications. You need to be I don't know, maybe you are going to have consequences in disease.
Okay. Perfect.
Not as easy as illness.
Okay, you catch the general idea, and that's great. Yeah, my explanation works. Yeah.
Okay.
I mean, a disease, you are wrong. Something in your body function is wrong. It's not going to recover. You live with the consequences. It's a chronic situation, right?
Mhm.
You really need to take specific labs, take treatment for the rest of your life, and change your lifestyle.
Mhm.
That's very important. And psychological and physiological function is evident changing.
Mm.
The best example, diabetes, right?
Uh-huh.
With an illness, a good example, a gastroenteritis could be.
Okay.
Okay, with an illness. With a sickness, a common flu.
Okay.
With a
Yes.
common flu, nobody goes to the doctor with a common flu, right? They
Mhm.
say, take
Yeah.
hockey and that's enough. Take a Tapsin and you're gonna feel better,
Yes.
right? And that's enough. So you get the meaning. That's great. You're a good one. Perfect. In that
Thank you.
way, let me see. COVID-19, illness, disease, or sickness?
Well, I think it depends. When the patients fully recover, it would be an illness. And when the patient is going to have any consequence or consequence, it's going to be a disease. Or if he or she is just feeling unwell, like with snooze or cough, and don't know that he or her is with COVID-19, I think that would be sickness.
That in that case could be considered a sickness, right?
Mm-hmm.
Yes, could be. It's a good answer. That's a good way. You have the criteria. That's great. That's the difference by talking to colleagues. What about tuberculosis? Illness, sickness.
It would be as same as COVID-19, illness or disease.
Yes, not a sickness, right?
Mm-hmm.
Okay, in which case tuberculosis might be a disease?
When the patient has these complications.
Yes, easy. Or maybe has tuberculosis that are out of lungs, right? For example, the POTS disease.
Yes.
Yes.
Mm-hmm.
Or we have the kidney tuberculosis.
Mhm.
That way, of course, it's a disease. There is no way to solve the situation, just live with the consequences and the treatment.
Mhm.
Well, you catch the idea. That's perfect. And that's the point. That's one of the best parts, because you can notice that illness and disease is a very dynamical concept, right?
Mhm. Yes.
If you receive a patient in the intensive care unit, how could you classify the situation, like an illness or a disease?
Uh,
It's in the intensive
like
care unit,
disease.
lots of devices and machines, right?
Mhm.
Illness or disease?
I think it's a disease.
Of course, it's a disease, because something is going extremely wrong. You really need the support from something extra to keep on working properly. I mean, as if we were machines.
Mhm.
And of course, you could recover from the intensive care unit, and the disease can get back to an illness, to a solution without consequences, according to the response of the treatment you receive. Right?
Okay. Mhm.
It's a very dynamical concept. The idea to catch the difference is, while reading, you might receive in I don't know, newspapers, in articles, these ideas inferred into the context. But now you catch the meaning, you have the idea, it's easier to understand the real objective of that information, I mean.
Yes.
Catching this, it's going to be easier for you to start working with the rest of the topics we have for this course. We,
Okay,
of
teacher.
course, we have exercises, writing down, making paragraphs by your own, something like that. And that's important to get it clear. And that's great. Well done, Carla.
Thank you, teacher.
About the rest of the slides, do you have any question, maybe?
No.
Everything
I
here,
don't.
I think. Just take time to read the terms and try to memorize them, right?
Mhm.
Perfect.
Okay.
Okay, perfect. Okay, your attendance is done. Thank you so much.
Okay, thank you, teacher.
So let me see. Keep on reading the slides. And if there's any question, you can send me a message by WhatsApp. Okay?
Okay, thank you.
According to that, we can solve the doubts. And well, yesterday was a very easy presentation. Tomorrow we have a very long one. It's around 64 slides to check.
Wow.
But lots of them are for checking at home and memorizing anatomical details, I mean. We have grammar rules to check again. Grammar
Okay.
questions about making singular to plural, I think, if my memory is not missing up these details. And that's great. It's going to be a good class, I think.
Okay, teacher. I will wait for it.
Yeah, so any question, don't worry, send me a message. And according to my free time, I'm going to be answering these questions, okay?
Okay, thank you.
Okay, dear. So let me see. Until your name, yeah, everybody was happy with the schedule, yeah. There are some students who didn't tell me if they agree or not with the role, but patience. If they don't talk, I cannot do anything. Patience, dear.
Okay.
So have a great night and see you tomorrow in the theoretical class, okay?
Okay, thank you, teacher. Good night.
Good night. It's nice to see you. Nice to meet you again. And let's keep working.
Bye, teacher.
Okay, bye, my colleague. See you. Okay, there was Carla, Diego, and Neil. They were on time. Let's wait for Liz Giselle. She's from USA. I don't know if she's getting into. She didn't say anything on the course, on the group, on the WhatsApp group. So let's wait. I'll be back with my next student. Bye-bye. Hey, Daniel. Can you hear me? Daniel Alejandro Cáceres. Can you hear me now? Hi. You're out of sound. Let me see, can you hear me? Can we talk now?
Hi, good night. Yes, I can hear you.
Hi, nice to hear you. Can you turn on your camera? Hi, perfect. Nice to
Hi,
meet you.
nice to meet you too.
That's perfect. That's the first contact we have. That's a good moment to talk together a little bit,
Yeah.
I think.
Yes, yes.
Well, yesterday I introduced myself. Now it's your turn. Let me meet you a little bit.
Okay. Well, my name is Daniel. My last name is Cáceres. I'm from La Paz, Bolivia, and I'm a medical student yet. Well, but the next year I'm going to be in my internship.
Perfect.
So I was thinking, don't waste my time now. And I see this course, and
Okay, in which university you are taking the medical career?
in a private one, Univalle.
Univalle, great.
Yes, yes, yes.
So some friends of mine are your teachers.
Oh,
Or were
yeah?
your teachers, maybe.
Really? Oh.
You can see I'm a little bit old. Don't ask how many years I have.
No, no, don't worry.
Don't worry about it. But some of my friends are teaching at Univalle in this moment. They are teachers from the beginning, from first year until the fifth year. Maybe one of them is your teacher, maybe your professor. But that's
Yeah,
great.
maybe.
In that way, I know how to expect from you. That you have a good level on the medical career. You're welcome.
Yeah,
Because Univalle is a very hard medical school, I think.
yeah, it is.
They have all the resources that you really need as a student. And you have a good chance to improve your, your job taking this course. Because
Yeah,
lots of information that you receive is in English. And it's going to be useful for you.
yeah, I believe that. I know that to get all the actualizations be all the day in the
You want to be up to date.
yes. If you want to be up to date, is you have to know English. You have to know the technical English, special,
Yes, the
because
medical.
it's not the same. It's a
Yeah.
difficult.
There are small differences from the social English, but the context is the idea to catch as a general view, and it's going to be easier to catch the correct meaning of the article or review you were checking at the moment, right?
Yeah, I was, well, my biggest fear is to maybe the people, or maybe in that case, my patient get a wrong idea, no?
Yeah.
That's what I fear now.
Perfect. So you have a good English while talking, and that's perfect. You're so fluent. Okay, then, so we are colleagues. Don't worry about it. You're on fifth year, almost finishing.
Yeah.
Internship. Well, Univalle School sends the students to very difficult hospitals.
Yeah.
That's where I was working, and I expect to work again next year. So maybe you might become my intern.
Oh, so you're gonna be
It's gonna be fun.
great.
I'm so crazy in my
Yeah.
shift. I'm an emergencist. I work in the emergency room, as I was telling you yesterday.
Okay.
So you want a intern at this toxic shift? It's
No.
me, yeah. You want to see something that is not common? It's me, yeah. Welcome to the
Really?
hardest doctor you could find in
Yeah,
medical career, in my opinion from lots of colleagues.
yeah.
We all have
Well,
who has the emergency room free without patients, right?
yes, I
I'm the
know.
opposite. I get into and it gets full at the moment with very
Yeah.
strange needs. Yes.
I have some friends that are now internship, and they told me, no, some people don't have patience in the night. The turn is easy, calm, they can sleep, but there are some interns that
That
they
never
have
sleep, right?
bad
Always
night,
working.
all
The
night.
one I'm the old, so don't worry about it. Yeah.
Yeah,
Every
maybe
car
they are
crash,
cursed with
crazy
something.
accident, or maybe the deliveries, well, parturitions are the worst
Yeah,
part for me. Well, strange things
of the
are
trauma,
coming. Yeah, I'm sorry.
of the trauma you get
Yeah,
in the hospital.
all trauma. Every crazy fracture, bone fractures are for me. Don't worry about it.
Yeah, no, I
Always
can imagine.
operations.
Yeah, yeah.
But that's great.
The experience is amazing.
Crazy experiences, and you said what's going wrong with me. But that's great.
Yeah,
So in that way, you are being prepared. You are almost ready for going to the big lines, we can say, to the big
yes,
attention. That's a good point to start. That's nice to see that you are finishing the medical career because you have the general idea of what we are going to talk about during the complete course.
yeah,
The basis for making this. And it's going to be easier for us to work together. Okay.
okay, yes,
If according to the course, well, taking the classes, you see something that it's not so clear, with all the confidence, tell me that you really need maybe more details or a next explanation. That's okay for me. Okay.
okay,
We can work in that way.
thanks. Now, if I need it, I'm gonna tell you the class was very clear about the last night.
Yes,
I was-
yesterday was a very easy and short class.
Yes, it was. Everything was clear. I don't have any doubt.
Perfect.
So I was waiting the next class.
Well, tomorrow we're going to have grammar rules,
Okay,
details like that, and we start with systems.
okay,
Okay, let me see. Yesterday we have this slide we were reading, right? We were talking about a little bit.
yes,
Did you catch the difference between illness, disease, and sickness, right?
yes.
Perfect. I need to
But I have a little doubt. I don't know.
yeah.
In the case of sickness, it's only a psychological way. I don't know.
No. A sickness actually is a real medical situation, but it's not so complicated. You don't really need to go to the doctor. You don't feel that it's so wrong in order to go there to take an appointment. Okay.
Okay.
For example, a common flu.
Okay.
Would you go to the doctor with a common flu?
No.
No, right? You just take your Tapsin, hot tea, sleep a little bit more, and that's enough, right?
Yes.
But what about illness and disease? Did you catch the difference?
Yes. That I was
Okay.
a little familiar with the words.
Okay, explain it to me. I must be sure that you get these meanings because into context you need to get the difference.
Okay. In the case of disease is we can say the symptom specific of a specific pathology.
Yeah.
In that case, in the case of disease, yes, the patient needs to go to the doctor.
Yes.
In the case of illness, it's also a specific disease or a specific pathology, but can affect in a psychological way also in around the people or in the no.
No, you're getting a little bit confused.
Okay.
Let's clear this idea. When you talk about an illness,
Yeah.
it's a real situation, medical situation. Your body is with something wrong. You go to the doctor, you take an appointment, maybe to your general practitioner, or the emergency room, who knows, but the fact is that you go to the doctor, you get evaluated, and you receive a diagnosis,
Okay.
right? In order you receive this diagnosis, you receive a treatment, maybe antibiotics for making it easier, right?
Okay. Yes.
You complete your treatment, take all your pills, and while finishing this, you recover completely without any consequence.
Okay.
So in that way, you can continue with your life in a properly way without more medication, I mean, right?
Yes.
The only lapse of time that you were on changes were during the treatment. But
Okay.
it's not for the rest of your life. It's just a small period in time.
Of course. Yes.
For example, a gastroenteritis. You take pills for around 7 to 10 days, you recover, and then you get back to your previous life without any problem, right?
Yes. Of course.
It's the opposite with a disease. In a disease, of course, you go to the doctor because something is going wrong, and you take some labs, specific labs, to get a diagnosis. That's why you need the opinion and evaluation for an expert and a specialist could be. According to that report, you receive a treatment and you receive a diagnosis. But this diagnosis is chronic, doesn't have a solution.
Oh,
Okay, that's the difference. With a disease, you only have to take your treatment the rest of your life. No way to change it. For example, diabetes.
For all life.
Yes, if you leave your treatment of diabetes, the consequences are obviously, right?
Yes.
Are present, are so fast, and you can die because of them.
Of course.
Or maybe an arthritis, right?
Yes.
Rheumatic arthritis. If you leave your treatment, the consequences are getting worse. You live with pain all the time. You cannot leave your treatment, right?
Yes.
That's the difference between illness and disease. Illness could be called an acute situation. An illness and acute situation. A disease, a chronic situation.
Okay, yes.
In both cases, your psychological environment, we can say, is changing, right? We have 2 minutes more. Okay, your physiological functions are changing, but the difference is that with an illness, you get recovered, but with a disease, you get recovered, but you need a treatment the rest of your life. You never stop being a diabetic, you never stop being with an arthritis, something like that, right?
Yes, of course.
I think it's clear now, right?
Yes, yes.
So if I ask you, what about COVID-19? Illness or disease or sickness?
Illness.
Okay, could be. Why an illness?
It's because you need to go to the doctor in the case you get worse.
Yeah.
You need a treatment, but with the time you get recovered and you get back to your life. If you don't have any complications during
any consequence, any complication, right? But what about if you lose your taste and don't get back with that? You finish the treatment and taste is not coming back.
No, it's becoming a disease in that way.
Yeah, it's
if it doesn't recover, it's gonna be a disease in this case.
As you can see, it's according to the situation, right?
Yeah.
So it's a dynamic concept to change between illness and disease. You cannot get just with the idea that, for example, COVID is just an illness, because it can become a disease. If you live COVID-19, the infection periods, but you still keep with chronic pain, It's a disease, right?
Exactly.
The post-COVID syndrome, of course, right?
No, yes, that's yeah.
That's the idea, to catch the meaning that it's a very dynamic process. And you have to be clear that in context, you are going to decide if it's a disease or an illness. And of course, you don't have the chance to make a mistake on that.
Okay. Yes.
What about a patient that is admitted in the intensive care unit? He is admitted with an illness or a disease.
Excuse me again.
What about a patient who's
Mhm.
admitted in the intensive care unit?
Oh, okay.
He's going
Mm.
with an illness or a disease?
Illness.
An illness.
Yes.
Okay. But consider this patient is using mechanical ventilation, is using inotropics, is using lots of fluids, lots of medication that it's not free for using in an open area.
In that case, I think it's gonna be a disease. I don't know if it get better. I think it's gonna be illness in that case, no?
Yes.
But if you stay in the with all the ventilation, with all the treatment that is getting and it's not getting worse, not getting better, is getting worse or staying in that way, I think it's gonna be or stay in a disease.
Okay, that's good. It's a disease in order. They get into and receive all the support I was telling you.
Yes.
Okay. Because the physiological dysfunction is so huge.
Yes.
It really needs an extra support to staying alive.
Yes.
But it can recover, it can improve during the process of the treatment and medication and everything, and get out from the intensive care unit and recover to an illness that could finish without any consequence, with just a long period at the hospital, but it depends on the case. That's the idea, to catch the meaning that the process, it's not going to be the same for everybody.
Yes, of course.
So with that idea, I think it's clear, this concept, right?
Yes, of course. Thank you.
Perfect. That's the idea, because while reading, while catching some information during the course, you need to get this so clear, so well defined in order to understand all the context we are going to talk about.
Yes.
And it's better, it's nice, yeah.
Yes, it's nice.
So that's great. That's great, Daniel.
Thank you.
Which specialty you are looking for?
What?
Which specialty you would like to do to study?
No, the surgery. I would like the surgery.
General surgery,
Uh,
the specific one.
I was thinking in trauma surgery.
Oh, perfect. So you
Yes.
start, well, here in Bolivia, you start with general surgery, and then you can go outdoors to take the trauma surgery.
Yes, I was thinking that.
Perfect.
In that
We
case,
really
it
need that kind of
is
surgeons here.
all cardiology. In that
Oh,
case.
great. Cardiology, it's not easy. So
It's not
hard.
easy. Yes,
Just one organ, but it's an amazing organ.
yes. Yeah.
That's great. You have
Those ideas.
a good topic to think on.
Yeah, of course.
Perfect. Okay, Daniel, so keep on reading. Okay.
Yes, thank
The
you.
slides from yesterday were easy. We were just like an introduction, the basic
Yes.
ideas, and a general overview from all the systems. But now we are going to start tomorrow with specific systems, skeletal, joints, and muscle systems.
Okay,
And of course, a list of pathologies. We don't have enough time to check all the details about pathologies,
of
but
course.
general view of them, okay?
It's
If
okay.
there's any question during the presentations, you can send me a message by WhatsApp, and then we can
Okay.
solve the doubt, okay?
Okay,
And
thanks.
every workshop, we are going to work together, maybe while talking. Maybe I'm gonna ask you, or if you have questions, that could be the best, we can solve the doubts, okay?
Okay, thank you.
That's great, you're in the 5th year, and you have the basis, the medical basis for doing this, so don't worry about it.
Yeah, thanks.
Okay. Yes, you for us, yeah. For everybody here.
Yes.
Okay, Daniel. So see you tomorrow during the theoretical class, okay? Your
Okay.
classmate was getting into, but then he left. Well, patience, his choice, yeah.
Yes, of course. Thank you.
Okay. Have a great night and see you tomorrow, okay?
See you tomorrow. Good night.
Good night. Bye.
Bye.
Well, I was talking to Daniel. He was on time. He had time and somebody get into, I don't know who was, but doesn't matter. I'm gonna expect my next student and I'll be back as soon as he gets into, let me see who's the next. Next is Misael. Well, he's 5 minutes late, so let's wait a little bit. Misael might get into, and according to that, we can continue. Bye-bye. Hi, Giselle. Please, Giselle. Hi, this is Giselle. Can you hear me? What's going on with this? Hello. Say hello. Hello, Giselle. Can you hear me now? Because we are out of time. Hi. Giselle? Again, she's out. Let me send her a message by WhatsApp and then correct the situation. Hi, Misael. Can you hear me? Misael. Oh, you're connecting audio. Well, we are late. Misael, can you hear me? Hi, Misael, can you hear me?
Hi.
Hi, can you hear me? I cannot hear you so clear. Hi. Hi. I need to talk to you, Misael. Please turn your camera on a little bit. We need to meet each other. Well, actually, we are out of time because your schedule is almost over. Misael, can you hear me? Well, okay, Misael. Hi, Gustavo.
Miss, good evening.
Good evening, Gustavo. Can you hear me clear?
Yes, I can hear you very, very clear.
Oh, perfect. Perfect, but let me correct this. Vivian and Misael, it's Gustavo's time because we have a role as a schedule that I sent yesterday. We are with him for 15 minutes. So following the role, try to get into the moment you really are assigned, okay? Because it's an individual moment. In that way, Misael, we are going to talk by a message by WhatsApp and try to solve the solution because I was expecting for you 15 minutes ago. It was not possible. So patience, I'm gonna remove your name from this session. The purple one when we cannot talk. And the new one when you get into, I'm going to get it away. I'm sorry, but we have to work on this. It's individual time. The same, Vivian, I'm sorry. Please come back at the moment you are assigned at the role that we were talking yesterday. I'm sorry, I have to remove this. It's an individual period. Okay, Gustavo, can you hear me now?
Yes, Miss, I can hear you.
Perfect. Can you turn your camera on? Just for meeting a little bit.
Okay, Miss, I'm sorry. I am
Are
on
you
my
on
way
the street?
to get home.
Okay, no, don't worry about it. You are going home, right?
Yes, Miss.
Perfect. Well, we were talking a little bit by chat, and you told me you are a civil engineer, right?
Yes, Miss. It's very interesting, the English. I wanted to learn more about the world of medicine.
Okay,
And
terms, I mean.
yes.
Perfect, that's great. I was talking to the academic supervisor because of the students were absent yesterday. And so in that order, I'm gonna take in count that you were working.
Yes,
So,
Miss. Yes.
if you have to stay on duty, you have to work, send me a message to take it in count, okay? And in that way, we can solve the situation, okay?
Okay, Miss. I am listening. I am listening to you, Miss.
Okay. So let me see. Did you have the chance to check the slides?
Yes, Miss. For example, the PDF that you sent me are the slides that yesterday you saw or you advanced in the class, in the first class. And I was watching, for example, many new words for me. And I was trying to memorize, but it's a bit difficult. I remembered why I didn't choose medicine to study.
No, don't worry. Okay. Let me know a little bit from you. You are a civil engineer. Where are you working now?
I can tell you that I am from Oruro,
Okay.
and I work most commonly all the time with architects. So I was in their office some minutes ago, and I saw the time, the hour, and I didn't want to be late at the workshop. And I wanted to ask you, the workshop is about what? It's about I don't know. Try to talk about the slides that you sent. And the other question I had is that in the final of this module, I don't know if there is a final test for this first module, and the second, I don't know how is that.
No,
I'd like to know more about that.
oh, okay, taking in account you are a civil engineer, you are not a medical provider. We can change a little bit the test evaluations in order to help you, not to drop you out, right? The idea is to practice, to continue, and to finish this. But we have to be clear on this situation. This is a course prepared for medical providers, for doctors specifically. And your career is so extremely different. I know about it because my sister is your colleague. She is a civil engineer here in La Paz. So
Okay.
I have a little bit an idea how it works. And well, we are in the opposite with a full, very, very huge difference. But I think we can do something interesting in order to complete the topics, okay? There are exercises that
I
I'm not
can tell you
going to ask
one
you,
thing.
of course, because I need medical criteria to solve some homeworks, but I can change them for you.
Okay.
For making it focusing to your area. I mean, not as a doctor. I'm not going to ask you as a doctor, okay? So don't worry about it.
Okay, as a patient.
Yeah, maybe as a patient or maybe as a translator could be, okay?
Yes, Miss. Just I wanted to tell you, I usually download many books from internet, and there are many areas in English. For example, there are English for telecommunications. I don't know, for military uses, for many uses, and I usually read these books.
Okay,
and when I saw that it's a course about medicine, I immediately wanted to pass and learn.
yes, you wanted to
thank
take
you.
it. So you are
Because
so curious, I mean.
Yes, Miss.
Well, that's great. That's a good point because curiosity is the basis of learning.
Exactly. That's it.
Great. So let me see. This schedule fits to you. Or do you prefer to come earlier? I have 2 free spaces earlier from students that are not attending the workshop. Or if I could try to change you later.
Okay.
Because being on the streets, I consider is not safe for you to go talking and checking your cell phone, right?
Okay, Miss. So you can. I wait for the new schedule. I am going to wait.
Okay, this is the idea. We have this first workshop. At this point, I only talked to 4 students from 6, with you 7, right?
Okay.
From these 2 students who didn't attend, the role is going to change. They are going to stay at the end because, well, I'm here in the workshop for around 5 hours. In that way, people who's not attending is going to be at the end, and the role is going to be changing in order you attend or not the session.
Yes, Miss.
This is scheduled at 8 p.m. Is that okay for you? Or do you prefer to change it earlier or maybe later?
Later, Miss, maybe 9 to 10, or better, the last one of all.
Okay, let me take it in count to correct the schedule. and I'm gonna send a new one at the end of this workshop. And we're going to get it as a clear idea, I think, how it works, okay?
Okay, Miss, thank you.
I'm
Thank you.
gonna
I'd
try
like to be
to,
the last one. That's not because I want. It's the time I'm at home, quiet.
yes, it's because your safe situation, I think, because it's not correct to go to the streets with your
Yes,
cell
Miss.
phone turned on. I think it's a risk.
Yes, Miss. Thank you. I'm sorry.
No, don't worry. I'm sorry for myself because I didn't take it in count yesterday. Well, I couldn't exchange it some more. But if people is not attending, I told them yesterday I'm gonna change the role according to the attendance. But if you really need to be at the end, like in this case, you could be the last one. That's okay for me.
Yes, every workshop I'm going to be glad to be the last one, Miss.
Okay, just for today, let's work at this time and then we're gonna change it, okay?
Okay, Miss. Thank you.
Perfect, Gustavo. So let me see. Do you have any question about it, about the slides you were checking? Maybe detail to check again?
Well, as you said, I am very curious. I saw the conversations about how doctors and patients talk between them,
Yeah,
and I was reading, memorizing, understanding, and I didn't know this way of treatment about those people, no, the doctor and the patients, and it was cool to learn that. And about the vocabulary, as I said, I have to practice more. Yes,
yeah.
I downloaded the PDF and I was watching all parts of the male, of the female, and the slides that you sent us. There is more information.
Yes, it's a lot of information, I
Yes,
think.
it's a lot. I don't know there are many parts of the body that I didn't know that
Yes,
existed.
and they are just the basics because we have some more anatomical details in the superficial structures and of course in inner structures. The most common ones are on the slides.
Yes, Miss. As I told you, I was I was learning, and it was interesting to see that kind of conversation that there aren't, or you don't find that kind of conversations in any books. That's
Yeah.
the truth.
Yes, but that's great. So it's catching the information you are looking for, I think.
Yes, Miss.
Perfect. Okay. In your case, well, some of this information is prepared for understanding the medical articles, medical reviews that we usually read for being up to date.
Okay.
And there are definitions that I was talking to your classmates for catching the difference, the correct difference between illness and disease. Right?
Yes, yes.
Did
Yes,
you
I was
catch that's a very important idea to get clear. Did you catch that meaning so clear without any trouble?
Yes, yes. I read there's one slide in which there is a difference. Yes, I was understanding.
Perfect. In that way, we have 3 minutes more. Try to explain it to me. In your words, by your experience, how you might explain what is a sickness, illness, and disease. Try to do it. Free activity. Don't worry. It's not for evaluation. Don't worry about it.
Okay, I understand it from disease. One se me fue la palabra.
Tell me in Spanish if you consider it's important. That's
okay.
Don't
Entendí
worry
por
about it.
disease una enfermedad un poco más como epidemia, un poco más grande que solo illness. Entonces, estaba entendiendo esa diferencia. Uno es más profundo que otro, entonces no habría que confundir eso.
Yes, these 3 ideas are different because of the complications they can bring, right?
Yes, sí, lo que entendí es que si no entiendes bien el concepto de uno y del otro, entonces puedes confundir en la gravedad de la enfermedad que puedes estar queriendo entender o tratar. Eso es lo que entendí, Miss.
Yes, that's great. You catch the point, but you catch it only in the Spanish.
Yes, Miss, I'm sorry.
Don't worry
Yes,
about it. It happens. And we must understand. You speak Spanish, you are not a doctor. It could be harder for you to catch this meaning in a clear way. A sickness is like a common flu, right?
yes,
You don't need to go to the doctor because you know that taking a Tapsin and a hot tea, you're going to be okay, right?
right.
An illness, you go to the doctor, you take medication, but you're recovered without any consequence. I mean, you get diarrhea, right?
Okay, okay.
You
And
take
disease
your,
is the top.
that's
I
an
understand that.
illness. Yes, that's an illness. You recover without any consequence when you finish your treatment and everything is going back to the normal life, okay?
Okay,
And a disease, it's a chronic situation, for example, a diabetes.
okay,
You don't
okay,
have a cure, you need a treatment for the rest of your life, and you don't have a chance to avoid your medication. That's the difference. As a general idea, that's the point, okay?
okay, Miss.
Is now clear?
No, it's very clear. It's very clear. Thank you.
Perfect, Gustavo. So our time is over and Andrea is here, yeah. So let's meet tomorrow in the theoretical class, okay?
Okay, Miss, the next workshop is on Thursday?
Thursday. Yes, Thursday.
Okay, Miss. Thank you.
Every workshop's Tuesday and Thursday, okay?
Okay, Miss.
Please wait for the final roll that I'm gonna send tonight while finishing, and then we can talk about the schedule. As you are asking for, you could be the last one according to the movement I have to make in order to solve the absences, okay?
Okay, Miss.
Okay, but I'm gonna take it in count. You could be the last one. Don't worry about it. Let me find a solution.
Okay, Miss. Thank you. Thank you for understanding. Thank
Don't worry. We are here for helping each other.
you. Yes, Miss. Anything about civil engineering? Ask me. Ask me.
Thank you. I'm gonna do that.
Okay.
Okay,
Bye,
bye.
bye.
See you tomorrow. Bye bye.
Bye, bye. See you tomorrow.
Hey, Andrea. Good night.
Good night, teacher.
I'm sorry, I cannot hear you so clear. Can you turn up your volume?
Okay, now can you hear me?
Yes, now I can do it. Can you turn your camera on for a little bit for meeting each other? Is that
Okay,
possible to make? Yes, perfect. Hi, nice to meet you, Andrea.
nice to meet you too.
Perfect. Let me see, I introduced myself yesterday. Can you introduce yourself now?
Sure. Well, my name is Andrea Collado Solis, as you already know. I'm 31 years old. I am from Nicaragua, and I am a doctor, and I am a specialist in internal medicine.
Oh, great, you're a specialist.
Yeah.
That's amazing. So we have lots of things to talk about. That's great, doctor.
Yeah, probably, but in Spanish, because maybe the terminology is quite difficult in English.
No, don't worry. You're going to see and notice that many things are very, very similar to Spanish. And you're going to catch that it's not as hard as it looks. Just read it and practice, and that's best. And welcome to this course.
You're welcome. Thanks a lot.
Yesterday, well, we were talking from the basics, as I can tell you, just a general view from anatomical landmarks, anatomical details, the superficial, and a general view of the inner organs, right?
Yeah.
Did you have the chance to check the information?
Yes, I was watching it earlier, and yes, there are some words that are new for me.
Yeah.
Others with not common pronunciation because, for example, when you're talking about thoracic cavity, pelvic cavity, abdominal cavity, and specific terms and anatomic landmarks. Yeah, that's quite difficult. Maybe not the writing, but pronunciation. I think you're gonna
Oh,
be a little bit complicated for me.
okay. If you need to practice on pronunciation, we can do this. Just sign all the slides we need to practice on and then just going to the point for not using all the workshop time on this exercise, looking for the situations, okay?
Yes, because you know, brachiocephalic trunk or something like that.
Yeah.
You know, it's not so simple to say in English. For
Yes,
example, subclavian vein or other arteries and veins.
yes, yes.
The writing, it's just basically the same, just
Yeah,
a few letters different, but the pronunciation, it's quite difficult.
yes. According to that, would you like to practice now pronunciation or do you have any other doubts?
Well, I think it's more about the pronunciation, the right pronunciation of different words that I would like to review.
Okay, so let me open the presentation, the PDF. It's easier in the workshop.
Yeah.
Okay, first of all, well, of course you catch the meaning of this, right? The difference in English about this definition.
Yes, even actually, I have the chance to listen to what you were saying.
Yes, to Gustavo, right? Gustavo is a civil engineer. I don't know how he decided to take it, but well, it's his choice.
It's quite weird that an engineer
Yes, it's not easy, but
is interested in these kind of things.
yes, actually, he told me he likes to learn a lot about many things, including medical situations. And I said, okay, let's do our best. But we cannot guarantee that it's gonna be easy to approve this course because it's designed for doctors. Okay, let me see. As soon as we stop in a place you need to practice pronunciation, you tell me, and then we look for the term, okay?
Okay, I think that part is not so complicated because there are general terms, and when we are talking with patients, I think we use general terms like forehead, chin, cheeks, ears,
Yes.
eyes, and that's not a problem. But
Perfect.
I think
I think the inner parts,
yeah, exactly. When when we are in that part, when internal parts of the body, with the division and ventral dorsal
Okay, perfect.
cavities, yes, that part. But I think
From this
mm,
side, any
no, I think
it's
it's
okay.
in the next one.
This one, thoracic
Yes,
cavity.
for example, let me check if in this one.
For example, this one. Let me get it big.
Manubrium, I don't know, manubrium.
Yes,
I know it's manubrio in Spanish, but manubrium.
manubrum. Manubrum in English.
And below that, below forearm, that cardiac notch of left lung.
Yes, cardiac notch of left lung. Okay.
That one, coronary vein of heart.
Yeah, the coronary vein. Perfect. From
I don't
here.
know if it's apex or apex, right? Just like
Yes.
in Spanish, or it just
It's not
sounds like A, the first.
apex. It's the same in English and Spanish because apex
Okay.
is in Latin.
Apex of heart.
Yeah.
And process, xiphoid process.
Xiphoid.
Xiphoid.
Yes, xiphoid process.
Okay, xiphoid process.
Yeah. This one.
And cartílago, costal cord.
Yes.
How do you pronounce that?
Yes, cartilage.
Cartilage.
Yeah.
Diaphragm,
Yes, diaphragm.
sixth rib. I think
Yes.
the other ones I don't have a lot of problem, but
Yes.
that ones, and in the next picture, yes, that
From this.
brachiocephalic trunk. I don't know
Yes.
if it's the right.
Yes, it's correct.
Trachea.
Yeah, brachiocephalic trunk.
Okay.
Yes,
Just
this.
like it sounds. Okay.
What about this?
Horizontal fissure of right lung.
Perfect. That's great. This one?
Let me check where. Ligamentum arteriosum. I know it's in Latin, but I don't know if it sounds
It's in Latin.
just the same in English.
Yes. No, it's in Latin. When you read books in English, medical, well, anatomical books, you find terms in Latin and in English for not repeating and rounding on pronunciation and making a huge mistake, a huge mess. That's why they mix this kind of information. So you can find in Latin and in English. Don't worry, you are doing a good job. What about this?
Diaphragmatic part of parietal pleura.
That's great.
And I wanted to know below middle lobe of right lung,
Okay.
oblique fissure of the lung.
Yes.
I don't know if it's right.
That's correct.
I have so many doubts in the pronunciation of the different pictures. I think in the next picture I have another
one.
doubt.
So, let's go ahead.
No, the next one. No. And
next.
Then
next. This one.
I think it's in abdominal cavity.
This one.
Yeah. Yes, it has.
Yes, here we are taking the arterial blood supply.
Right gastric, gastroduodenal. I don't know how you pronounce that.
Okay. Right. Right gastroeploic. Which one? Right.
To the right celiac trunk, common hepatic artery proper, cystic. Oh, I don't know if it's cystic or cystic. Cystic. And below that, how do you pronounce gastroduodenal?
No, that's the way. Give me a second.
It's too long.
Dalila, we start in 3 minutes, please, okay? Don't worry about it. That's okay. Gastroduodenal, similar to Spanish.
Okay.
Right gastric.
Right gastric, right gastroepiploic. Superior mesenteric.
Yeah.
Superior pancreatico duodenal.
Pancreatico-duodenal.
And I think if it's not quite different from Spanish.
It's very similar to Spanish. Because these anatomical details are not going to change even though in the way of writing down, right?
Yes.
For example, the ascending colon, the right colic, ileocolic, intestinal, well, they are the blood supplies, but that's why they look so similar. What about this?
Splenic.
And this?
Spleen and splenic.
Yes, spleen and splenic. Spleen, like smile, right? Spleen.
Left gastroepiploic.
Left colic, sigmoid. Okay. That's good. You are reading in a good way. Don't worry about it. It's because it's very similar to Spanish. About this, I think it's easier. It's just
yes, I think The last one to the right, I know diaphragm, liver, but how do you pronounce the last one?
Gallbladder.
Gallbladder.
Yeah.
Okay.
The gallbladder.
Yes, I think it's just I need more practice because I know the words, I know where they are, what they are, but it's just the fluently to say it.
Yes, don't worry about it, Andrea. While practicing, while checking the slides, because it's a general view about inner organs, you are going to have the chance to practice on this with more detail. I'm sorry, I'm sharing it again. I'm sending you the diary pool to take attendance, okay?
Okay.
And I was telling you, yesterday we had a general view of anatomical details, the superficial details and the inner organs, a very general view. Tomorrow in the theoretical class, we start with systems and different
Something
details.
more specific.
Yes, more specific structures, and it's going to be easier. As a general view, it gives you an idea what we are going to check all this course. So it's helpful.
Okay.
And
Thank you.
don't
I clear my doubts, and that's important.
yes, that's the objective of the workshop. If we have doubts about, I don't know, meanings, pronunciation, that's the idea of this moment for speaking, for talking together, okay?
Okay.
And if there is something that it's not possible to make because 15 minutes might be not enough, we can talk by WhatsApp, okay?
Okay, perfect.
I think it's going to be a good point to take in count in order to consider all the information and not miss this opportunity in this course, okay?
Okay, thank you very much.
Perfect, Andrea, nice to meet you so, and see you tomorrow in the theoretical class, okay?
Okay, bye. Thank you.
Okay, have a great night, and if there are still more questions, send me a message by WhatsApp, okay?
Okay, have a night too.
Okay, so see you tomorrow. Bye-bye.
Bye.
Okay, Dalila, now it's our time. Can you hear me?
Yes, I can hear you.
Please, let's turn on our cameras to meet each other, okay?
Hi, nice to meet you.
Meet you. Thanks for your attendance.
Thank you for your time.
No, it's your time. I'm here for helping you to solve doubts, okay? But first of all, let me meet you a little bit. Can you introduce yourself?
Okay, my name is Dalila Cordova. I'm 28 years old. I'm a doctor. I graduated in 2019. And well, I actually right now I'm working at university teaching biochemistry lab.
Wow, oh, that's great. Biochemistry is not an easy fact.
No, it's not.
So brave to do it. So you are a general practitioner, or do you have a
Yes.
specialty?
No, I'm a general practitioner.
Perfect. That's great. In that way, we are colleagues. Yeah. Well, we all are colleagues in this course, but it's different
Yeah.
when you're a medical student or maybe a specialist, right?
Yeah, it's different.
But in that way, in order we are general practitioners, it's easy to catch the ideas and easy to talk to you. So it's great.
Yeah, we have terms like.
Yes. Where are you from? I'm sorry. Oops, I cannot hear you. Oops, Dalila, we got out of signal. Let's help this device. Dalila, can you hear me? Oops. Hi. Hi, Dalila. Can you listen to me now? Oops, you're out of sound. I'm sorry.
There. I can hear you, but you freeze for a while.
Yes, it ran mad because everything is working properly.
Yeah, I think it's my internet because I'm from Guatemala, and right now we have electrical storm and rain.
Yes,
Yeah, so I think it's my internet.
yes, it could be. Here in La Paz is so cold, and when it gets windy, the internet connection gets worse.
Yeah, it's been like that this whole week. It's like very hot in the morning and at midday, and then it just start raining, electrical storm, a lot of wind.
Okay. Well, perfect. From Guatemala, it's very different the weather, I think.
Excuse me?
In Guatemala, well, from La Paz, all the weathers are different. At this point, I
Yeah.
realize because La Paz is, well, has the 4 seasons in one day.
Yes.
It's hot, cold. I don't know. It's crazy, and windy is the worst.
Yeah. Usually we have like a lot of hot temperatures in March and April, and in May through September, a lot of rain. And then it's just cold and a lot of wind.
Okay.
Mhm.
It's not easy, so let's consider this. If you have internet disturbances, please let me know, okay?
Okay.
Perfect. So let me see, did you have the chance to check all the slides from yesterday?
Yes, I did.
Okay, perfect. Do you have questions, a detail to check again, maybe?
Yes. I was wondering in the recovery,
And the meanings.
like, if there's a word or an expression to say, like, when we don't know what it's gonna be the outcome of the patient, like we don't know if he's gonna recover or if he's gonna deteriorate. Like when in Spanish we say tiene un pronóstico reservado.
Yes, the
Tenemos que
prognosis.
esperar.
Yes, the prognosis.
Mhm.
Talking about the prognosis, right?
Mhm.
Can you watch my screen? Ay, Dalila. Again, it's freeze. Mm. Hi, Dalila. Hi, Dalila. Dalila,
I'm here.
can you hear me now?
Yes.
Screen got frozen again. What?
Yes. But I think I got it now.
Oh, okay, don't worry
Mhm.
about it. When you say, well, when you talk about prognosis, you can say it's a reserve or it's an enclosure prognosis. Okay.
Okay.
Can you hear me? Or let me write it down. I'm sending you a message by
Okay.
chat.
Okay. Reserved prognosis.
Yes.
Okay.
Prognosis. Okay, there's another way to express this idea. In that way, according to the situation, you can use one or both of them. It depends on the situation, okay?
Okay.
Both of them show you that the patient has no possible end. So you don't know if it's gonna improve or deteriorate, as you were talking at the beginning. But
Okay.
when you start enclosure, it's for going to the worst prognosis.
Okay, worst.
When you say reserved,
Mhm.
there the
You
possibility
feel
to
like possibilities that he could recover.
maybe could recover it, but with an enclosure is the worst. It's the high percentage is to deteriorate. Okay,
Okay.
that could be a difference we can make on this.
Okay.
Okay, it's now, well, as an extra, yeah, as an extra definition, yeah, it's added, yeah, because I never think to write it down at this point.
Mhm. Okay.
Can you hear me, Dalila?
Yes, yes.
Okay, perfect. Going up about the meanings, are they clear now?
Yes, they're clear.
Perfect. About these three ideas, illness, sickness, and disease.
Yes, they're clear.
Perfect.
I had another doubt with where the anatomical parts are
Okay.
in the male one.
Okay, this guy.
Yes. So the first word is in Latin, and the next word, like in forehead, and then we have frontal.
Yes.
So when we're writing like our notes, which one is the appropriate one to use?
The one in parentheses, the medical term.
Okay.
While writing down the medical report, you have two options: to use Latin or medical English, not the common term. Okay.
Okay.
That's the best way to we can say a professional way to talk about. Because, well, if you write down in Latin, you are following the school, the thought about the medical teaching, we can say.
Yeah,
the medical term is the way we use a lot in order to get a general way to express between colleagues. Okay.
Okay. Okay. Okay.
Is that clear now, right?
Yeah.
Perfect. Maybe another question.
Let me see. I have my notes here. Oh, when you with the upper limb and lower limb.
Which one? I'm sorry.
In the image where it's the female parts.
From here.
Yeah, that one.
Upper limb
Yes.
and lower limb.
Okay. So like upper limb, it's like all the parts like shoulder, forearm, and hand.
Yes, as a group, the upper limb. And the lower limb.
Buttocks, thigh, back of knee,
hip to
calves.
toes, as a group.
Hip to toes. Okay.
From hip to
so
toes.
If I have like let's say a 3rd-degree burn in like buttock, thigh, and all of the heel, I could say like it's a 3rd burn degree in the lower limb, in the right lower limb.
Yes, perfect. That's a good way.
And I could specify like it's the posterior lower limb or the anterior lower limb.
Yes, you have to be so clear in which specific part, lateral, external, or I don't know, frontal, I don't know, according to the situation, right?
Okay. And in the slide that says referring to the body, to the parts of the body.
Parts of the body, okay, the inner anatomical landmarks, right?
No, I think it's the neck. That one.
Referring to parts?
Yes. Yeah,
okay, well, this is just an idea That
Mhm.
limb is referring to upper or lower limbs, or arms or legs, I mean. Patients are not going to tell you my forearm. They can tell you this expression. They can come to you and tell you my limb is broken and just show you the specific anatomical structure that is in trouble. That's why we must consider that limb for patients is everything as a group, as I was telling you, but they use it as if every part is a limb.
Yeah. Okay.
Trunk just for catching the difference and the way to write it down and just extra information.
In the in this table where it says, do you get any pain in? And it says the chest and your stomach, your back. Is there like a rule when you have to use like the or your?
No, it's according to your experience and how the patient is going to understand you.
Oh, okay. Okay.
If you prefer to use, do you get any pain in your stomach or in your chest or in your back? That's correct. There are different expressions just.
Okay. Okay. Mm,
From here, maybe we are almost finishing. It's easy.
yeah, I think we're okay with this class. Just like the things I pointed out, and like in this part, I think we need to like review all the terms of the body parts and like just
Yes.
take that in count. Like we're just like no, we know it in Spanish, so we just have to do the association in English.
Yes, yes, of course. It's making a translation, we can say, right?
Yeah. Yeah.
Okay, Danila, I sent you the diary pool to take attendance. Did you check that?
Yes, I just did it.
Okay, perfect.
Okay, thank you. See you tomorrow.
Okay, so
Bye.
let's fill this. Okay, bye. See you. Hi, Belen. Belen, can you hear me?
Yes, hello, good night.
Good night.
Hi.
Let's turn our cameras on a little bit for meeting each other.
Okay.
Okay, perfect. Well, yesterday I introduced myself a little bit. Now it's your turn. Can you introduce yourself? Just a detail.
Okay. Well, my English is not good enough because I don't practice long ago, but I will make my best. So I study medicine in Cochabamba. And
Which year you are a student?
what?
In which
I
year
can
you are
hear you.
studying? I mean, third year, fourth year, fifth year?
Fifth year.
Okay, perfect. Almost finishing.
Yeah. Yes. Well, I'm a little nervous for the internado.
The internship, right? It's not easy.
Yes. Yeah. Well, but I study in San Simon
Great.
University.
Yes, the public one. That's great. A good, very good university. It's so hard.
Yes, maybe. We have well, it's interesting because there's a different kind of no sé, teachers, doctors.
The professors.
Ajá, eso. And today I was looking for the diapositivas. ¿Cómo digo diapositivas?
The slides.
Slides.
Yes.
And your slides, and I don't know how how can I memorize?
Oops, Brenda, it got frozen. I couldn't hear you the last part.
I'm so sorry. My internet's so bad. I have Conteco, is Lenteco. It's so bad.
Yes, it's Lenteco. You are right.
Yeah, it's. I don't know what's going on with my internet, but I was telling you then, how can I memorize all the information, all the vocabulary?
Practice. That's all.
Yeah.
Yeah, no other way.
Yeah, I think I will make flashcards or something, or this kind of stuff, because I don't know.
This is according to your experience. I've been reading and teaching this a lot, so it's different from my position, but if flashcards work with you, they're perfect. But maybe printing without the labels and then practicing labeling again the structures could be a good exercise. Of course, we have homework making that kind of job. So it's going to be interesting because they are kind of jokes, kind of games. And you don't really notice how many jobs you're doing at the moment.
Yeah, well, I think the flashcards are going to work, or going to be okay, but I don't know.
Your experience.
Yes, it's, I didn't study English. Well, I study. Yo estudié, no sé, hace 5 años, 5 years ago, and now I'm like returning, and it's a little complicated.
Yes, it's a little hard. I mean, I understand it's not as easy as it looks, but don't worry, with practice at the finish of the module 1, of course, you're going to notice a difference while talking and catching the vocabulary. Don't worry about it. I promise, I promise. We have a lot of job to do.
Oh, so I have a question. All the homework you're going to send us by Zoom or WhatsApp? The exercises?
Yeah, homework by WhatsApp. The slides according to your attendance to Zoom, by Zoom.
Okay. And all the meetings,
from this module 1, we have the link for the theoretical classes and the workshops. It's the same. In module 2, we exchange the Zoom link. Okay.
Okay. And our meetings, for example, today we're talking about me and having a normal conversation. But for example, Monday to Thursday, we are going to have an oral exam or test or something.
Well, I take a scores like for homework. During the workshops, I expect your questions. For example, if you tell me I don't have any questions, I catch all the information, okay, I'm going to ask you. I'm going to check it, following specific details you really need to know, right? Maybe definitions, maybe explaining me some ideas, things like that, because speaking is taking in account all the course, not an oral specific evaluation, because we have time to do it during the whole module 1 and 2, okay? The writing part, we have a final test, of course. In the final test, I catch how you were working, because it's a lot of information to review. And everything is coming from the slides I sent to you. So don't worry about it. You have the material. In order you get into the classes, you receive the material. That's the way I work. Oops, I think she didn't listen to me. Belén.
Sorry.
No,
I think it's so bad. Lenteco, never have lenteco. Nunca tengo.
No, I have some relatives in Cochabamba and they told me the same. Never lenteco.
And I live so far from the city, so here's no other, we don't have a lot of options, just lentejo
It's not
and
easy.
lentejo.
No, don't worry about it. I was telling you about the speaking, all the classes I take it in count. According to the doubts, the questions you make to me, I can explain it to you. If you don't have questions, I am going to ask to you.
Oh.
I'm going to check the slides and, well, I know which ones are the most important parts to get evaluated. So I'm going to ask the details. So if you tell me I don't have any question, okay, it's not a sin not to have a question, but it's my choice to ask you something specific.
Okay. And how is going to be the test, or oral test? Or
No,
writing?
the oral evaluation, the speaking evaluation is taking all the workshops. That's why it's individual and we talk 15 minutes one by one, right? That's why we have enough time to check if you are catching the meanings, the definitions, the specific words we need to practice and improve. The final test, is writing down. Handwriting, not typing, because by typing it's easy, copy and paste. But by handwriting, I catch grammar mistakes and details like that, or exchanging expressions, that it happens. I usually send my test by filling blanks, matching columns, writing down paragraphs. It's very easy. If you study the whole model, it's going to be a piece of cake. If you make homework, it's going to be so easy to make. If you decide not to do it because it's a choice for everybody, well, you're going to see that it's a lot of information to try to check in an hour. It's not possible to do it. Of course, homework, it's not so short. Homeworks are long files, but they are prepared in order to practice the whole information we check during the 2 theoretical classes we have in the week.
Oh, and when are you going to send us the work?
On Thursday night. When we finish, yes, when we finish the second workshop, while solving doubts, I send the file to the WhatsApp group with the guidelines. And into the guidelines, I tell you the deadline when it's the best moment to send it back to me. And as I was telling you, you have the chance to print the file and fill the file and send me pictures in a PDF, or just send me the answers. And I'm gonna understand it. If I don't understand what you send it to me, I'm gonna ask you, I don't understand your file, please explain it to me now.
Okay. Okay, well, okay, it sounds good.
Yes, as I was telling you, there's a lot of homework I sent, long files in order to get used to the vocabulary we really need.
Yeah.
Yes, I'm not going to ask something. Well, there are some slides that I tell you just for information, just for catching vocabulary. For example, from yesterday, the illness and wellness continuum. It's a double arrow that is showing you how the healthcare situation is changing from one side to another. How you can identify in which place you are at the moment. It's very easy to use the chart. But if you read this chart, you might catch some vocabulary that it's not common. It's for healthcare providers. That's why it's important to read all of this information. If you tell me I don't have any doubt, okay, I can ask you meanings from that expressions. What's the meaning of this expression? And then you tell me what, and I know that you don't understand this part. And then you clarify this detail.
Okay.
That's interesting, I think. That's a good way. The model 1 is the base of the model 2. And this model 1 is so theoretical. Lots of things to memorize, lots of things to practice in order to catch the meaning in English. In model 2, you have the chance to write down by yourself and start using lots of this vocabulary. In English, in medical English specifically, you use a lot of abbreviations, medical abbreviations. In model 2, you must use them in order to fill homework. If you don't do that, well, it's a mistake. That's why I'm going to show you the slides from tomorrow with the most common abbreviations for every system. And then you have a key to improve this part.
Okay. Well, I think if I do the homework, everything's going to be okay.
Yes, yes. If you practice with the homework, it's going to be fine. It's possible to make. It's not a very crazy file, and it's but maybe some details from grammar rules that are not in this specific slides, maybe, but they are from social English. So the social English is different from medical English, right?
Yeah.
These details are important to take in account.
Oh, I have a.
Yes, I send you the pool to take attendance. Please fill this one, and that's all.
Okay. Yeah.
Great. Thank you so
you.
much. So do you prefer I call you Brenda or Belen?
Oh, please, Belen. Nobody calls me Brenda. Who is Brenda? No.
You don't really met Brenda.
Yeah.
Okay. Okay, Belen, I'm going to use that name.
Thank you.
Okay, Belen. So see you tomorrow in the theoretical class, okay?
Okay, see you tomorrow. Good night.
Good night. Have a great night.
Bye.
Bye. Hi, Pamela.
Hi.
Hi, how are you?
Fine, you?
Fine. I think it's a hard day, the workshop, because we are a lot of students. Yeah.
Yes.
But that's okay. So let
I
me
am.
see. Yesterday I introduced myself. Now is your turn. Can you introduce yourself a little bit, please?
Okay. My name is Pamela. I am from Ecuador. Here is 1 hour earlier. So here is 8 o'clock.
Okay. Here in Ecuador is 8?
Yes.
Wow,
That's
here
why I asked to
just
change.
an hour in difference.
Yes. That's why I asked to change, because it was too early. The other hour schedule. So this is fine for me.
Okay, that's okay now.
Yes.
Okay. So we are not going to change it. We are going to try to stay here, okay?
Yes, please. It's okay.
Okay. Are you a medical student, general practitioner, specialist?
No, I graduate last year. I am now working as a pneumology resident in a cancer hospital.
Great. That's so interesting.
I want to study the specialization. It's
The specialty.
and the specialty in pneumology, and I was looking for some universities, and I want to try in Buenos Aires University, and they ask medical English for
getting right.
Yes, and that's why I am taking these classes.
Okay, so you are focused to take the residency course in Buenos Aires in Argentina.
Yes, I would like maybe next year.
Okay, do you have the specific topics about the requirements, I mean, from the university in Argentina?
Yes, they're not so,
not so hard things, right? A general view, maybe?
Well, they don't ask much, I think, but they ask the medical English, and well, that the title is I don't know how to say that the Ecuadorian title of medicine is valid in Argentina. And well, they ask 1 year of residence.
Yeah, and then you can continue
Yes.
there.
And they ask to give an exam.
Okay.
This year is next month, but my title doesn't. I don't know.
Ready.
Yes, it isn't ready. I sent my papers in February, but
Yeah.
it takes too long. So I think next year I will be ready to give the exam.
Yes, well, it's a good chance to practice the medical English this whole year. Well, I was asking for you the requirements because following this course, we have the basics just. I mean, 2 months is not enough to check maybe the whole information you really need to take the residency course. Because I think they could ask you about investigation and how to make a clinical history, how to write down properly, maybe, right?
But
More,
they don't make any specific.
they did the specific requirements.
Yes.
I tell you that because for going to England, for example, in the requirements, they ask for writing down letter of referral and a clinical report, a full one. And there are exercises that we added with some students. But to Argentina, I'm not sure which ones are the requirements. But let's try to do our best with the vocabulary and expressions, because here we are going to learn how to talk to a patient, how to organize the information in order to write down properly. But certainly we don't know if it's into your objectives. Maybe could be enough, maybe not.
If this could be the first step.
Yes, I think as a basis is a good point to start, right?
Yes, and then I can look for other more specific or more
courses, maybe just like a basis, it could be so helpful, I think. Okay, so let's keep on practicing, and that's great. So let's keep on reading, yeah.
I am not very good at reading the technique articles, the medicine articles. It's very hard for me. I can, but very slowly.
Don't worry about it. Just with practice, it gets improved. Don't worry about it. Here we have some ideas, some definitions that must be clear in order to understand the medical articles, reviews, for improving this information, okay? So let me see. Did you have the chance to check the slides from yesterday? They were so basic, I mean.
Yes, I checked them.
Okay, do you have any question about them?
Yes, I have one. Let me look the slide. In one of the slides, it says in current conditions such as cancer, the word of improvement.
Yes, this is right. Remission.
Yes, remission.
Yes. Yes.
I don't know if I'm not, if my if I don't understand much the word remission, but I think remission is when that's talking about cancer. The cancer is no, it's okay. It's improving, but improving in the good way. It is going. out.
Yes, it's getting under control. It's
Yes.
not going
Because
to a situation, you control it. It doesn't advance, doesn't get worse. Okay, it's not
when
going to hurt you so
read-
much. It's under control.
Yeah.
Tell me, Paul.
Because when I read improvement, I thought it was like going on the cancer, and that's why I was confused.
No, let's try this idea. Let's go from this. When the patient health is in the process of returning to normal condition, the patient is improving. For example, you got gastroenteritis, right? A diarrhea. You take your treatment, your diet, and according to the process, diarrhea is getting less and less quantity, and now it's avoided. You improve and you recover completely. At least you get infected again. You again get another infection, right? But you improve. Okay?
Okay, yes.
When we talk about remission, it's a condition that it's chronic. It's a condition that has periods when you are with the disease. Then you get better, you feel better. You get in remission, the disease is under control. For example, not only cancer, maybe in an arthritis.
Okay.
Right? If you take your medication, the arthritis is in remission, is under control. It's not getting worse. It's not deforming your joints, right?
Right, yes.
That's a remission. That's the process when everything is under control, is not getting worse, but the situation is still present. If you leave your medication, you relapse again and get worse again, I mean.
Okay, I understand.
Now it's clear? Is that better now?
Yes, it's better now. Yes, I was confused when I was reading.
When you improve, you avoid the situation. You solve everything, there is no consequence. When you get in remission, the pathological situation is under control. There is no other way to leave it. You are not going to recover from that. You are going to control that, and that's enough. Just taking control. The same as in a diabetes, for example. The diabetes mellitus, you take your medication, your glucose levels are great in your controls, you are on remission because everything is under control. You stop taking your medication or receiving your shots of insulin, maybe your treatment goes away and you relapse again, and you have consequences of this. The pathological dysfunction is getting worse.
Yes.
Easy to catch, right?
Yes, it is. Oh.
Perfect. Any other question, maybe?
Yes. I don't know if I understood well the difference between sickness, illness, and disease.
Okay, and explain it to me. What do you understand about it?
I understand that sickness is just the symptoms.
Yeah.
Illness is something that is when you get when you need to take medicine and it is going to get away I don't know the illness, the disease, I don't know. And the disease is where is something chronic, like diabetes.
Yes, could be. A sickness, for example, a common flu, right? Symptoms that you can manage, you can control by your own. Take a cup of tea, lemon and honey, and that's enough, right?
Yes.
An illness, as you said, an acute situation that has a treatment and has a solution. There are no consequences, okay? No way to get worse. I mean, you receive the treatment, and then when you finish this, you go back to your previous life without any trouble. You recover completely. In a disease, as you said, it's a chronic situation. Something is changing completely your lifestyle. You need a treatment for the rest of your life. And of course, there is no cure. There is no solution. Diabetes, as you said, is a good example, because if you leave your pills, your shots of insulin, you get with consequences, right?
Yes.
That's the difference. You catch the general idea, and that's a good point. Catching these meanings, it's going to be easier to read the context of lots of up-to-date files, and then it's easy to get the objective of this information. Wow, we are on time.
Yes.
Okay, Pamela, let me send you the pool to take attendance, okay?
Okay, thank you.
Thanks to you for being on time. Okay, can you watch the pool?
Yes.
Perfect. That's great. Oh, okay, dear. So see you tomorrow in the theoretical class, okay?
Okay, thank you.
Okay,
Bye.
bye-bye.
Good night.
Good night. Hi, Vivian.
Hi, teacher.
Hi, I'm sorry. In the previous time, I take you out from the session because I was with your colleague.
Yes, I get confused, teacher. Sorry for that.
No, don't worry about it. It happens. It usually happens. Don't worry. There's no trouble.
It's okay.
Okay, let me see. Yesterday I introduced myself. Now it's your turn. Can you introduce yourself a little bit, please? Let's meet each other.
Okay, I have to turn on my camera.
Just a little bit, please. Just for today. No sessions. I won't be a trouble.
Hi, teacher. I'm Vivian, and I'm 19 years old. I'm a third year of the career of medicine, of course. I live in Sucre.
Okay, you're on third year.
Yes.
You are finishing the basis, the theoretical basis of this, right?
Yes.
In that way, how do you have enough time to take this kind of course? Because it's a lot of information to review.
Yes, I just arrived 1 hour ago. And
Wow.
I'm like, I have to enter, and for that.
Well, that's great. You're focused on this.
Yes, I just finished here in Sucre. There is an institute that is CBA. I don't know if you.
Yes, in La Paz we have the CBA too. We are from CBA. Oh, we are almost classmates. Yeah, we can say that.
And I graduated last year in December.
Ah, great.
I want to improve. Yes, I want to improve and improve.
Yes, practicing is the best way, and listening and reading, of course.
Yes, since my partners for my career really don't know anything about English, and I'm one step more, and I like it.
That's the best. That's the best way, because you have the chance to up-to-date properly with the most new articles, reviews, and that's great.
Yes, and I feel
good choice.
Yes. Okay.
Keep that way. Don't never miss that way of working.
Yes, teacher. Okay. So
that's great, Vivian. So you are med student, perfect. On third year, you still need a basis of pathologies, I mean. But in this course, we are not going to talk about specifically about pathologies like at the university, okay?
Yes, it's okay.
So you have to get a general view of many things, but they are not specifically pathological situations. Maybe some details could be out of your of your basis now, but if there is any trouble, please let me know, okay? In order to solve the solutions and try to fix the exercises for you specifically, okay?
Okay, teacher.
For example, in one homework file, we have the description of pain. We have to describe the radiation of pain. At this point, I think you didn't check this information, right?
Yes, no.
Okay, so in that way, you remind me, I didn't check this exercise at the university, at college, maybe something like that. And I'm not going to take account that question, of course, because you are not ready for that. So don't worry about it. We can fix it.
Okay, teacher. Okay.
Okay, dear. According to that, yesterday I sent the slides to the Zoom chat, right? Did you have enough time to check that information?
Yes, I check it. I have some question about that. It's just pronunciation.
Perfect. That's a good way to start. Let me open the slides. Can you watch my screen?
Yes, wait, here, I don't understand the difference between illness, disease, and sickness.
Okay. These concepts, of course, are different from Spanish. In Spanish, you are sano o enfermo, and that's enough. You don't have a different ideas to express the correct situation, but in English, you have this chance to classify how difficult could be the situation for the patient. When you talk about a sickness, it's about a situation that you can solve by your own. I mean, if you get a common flu, do you go to the doctor?
No.
No, right? Because you really know that you don't need that kind of attention, of attendance, I mean. You need to take your Tapsin, maybe, hot tea, honey and lemon, and that's enough, right?
Yes.
So with the sickness, you take it, well, relaxed, we can say, and then it's going to be solved by its own. No, don't worry about it. It's very different from an illness or disease. An illness could be called an acute situation. I mean, you get a gastroenteritis, right? You get fever, pain, diarrhea, and get dehydrated, right? You make an appointment to a doctor, in the emergency room, to your general practitioner, who knows, but you go to the doctor. The doctor makes the physical exam, and according to the findings, to the symptoms and signs, the doctor gives you a diagnosis, right? With the diagnosis, he decides a treatment. He makes the prescription, you take your pills, maybe antibiotics, and things like that, right? You finish your treatment and recover properly without any consequence, okay?
Okay.
You complete your treatment and everything becomes great as the previous situation, I mean. Don't need more studies, you don't need something extra because everything is going great again. On the other hand, you have a disease. A disease is well, we can call it a chronic situation because the physiological and psychological dysfunction is so clear. You can notice that something is going deeply wrong. You go to the specialist asks you for lots of investigation, I mean labs, x-rays, CT scan, who knows, right? According to the findings and the clinical symptom signs, the specialist, the doctor, gives you a diagnosis. For example, a diabetes, right? Of course, you start your treatment, but you must realize that your treatment is going to be the rest of your life. You don't have a cure. You only control the situation. You don't have a cure, and you must get clear that everything in your life is going to change. Okay?
Okay.
That's a disease, a situation without a solution.
Okay, teacher. Thank you.
Now it's clear, right?
Yeah, it's clear.
So if I ask you about a tuberculosis, it's an illness or is a disease?
Okay. It could be both.
Yes, could be both. What's the
both.
difference? According to your criteria, which could be the difference in this?
Okay, maybe it could be
Yes, tuberculosis, if it's pulmonary and
Yes.
the patient has enough resources to improve his lifestyle, his nutrition, everything he needs, the treatment is going to be effective and you're going to improve, right? You're going to recover without any consequence, right? But if you don't have the chance to change your lifestyle and the tuberculosis is not in lungs, it's for example in kidneys or in bones, that becomes a disease, right? Because you live with the consequences of these actions, of these situations. So that's why they could be both. I mean, these ideas about illness and disease are dynamic. You can start with an illness, and because something is not under control, it can become a disease, right? What would happen with a patient who's admitted in the intensive care unit? Is getting into with an illness or a disease?
Disease, a disease.
Great. Why a disease?
Because it needs an evaluation from an expert.
Yes. Of course, the intensivist, the intensive care specialist is not the first one who's going to check you up, right? You have the support from some doctors. You are under mechanical support. I mean, mechanical ventilation, fluids, infusions. Well, it's very, very difficult, right? Lots of medications that are not for open areas, right? You get into with a disease. For example, COVID-19, that pneumonia, viral pneumonia, right? The treatment is effective. You get improving and improving, and then you are discharged to the general room, the internal medicine room, for example. It's still a disease?
No.
It becomes an illness, right?
Yes.
Because you're without consequences. Your body has the chance to solve the solution, of course, with the help of medication, and then from disease, it becomes an illness. Right? That's the difference. That's why this concept, these ideas are dynamic. They can change one from another, but it happens.
Okay, teacher.
Is that clear now?
Yes, teacher.
Perfect. You were telling me something about pronunciation. Do you have the details, the slides of them?
Yes, it was it's okay to say the thoracic cavity. Cavity is okay?
Yes.
Cavity. Okay.
Thoracic cavity. Let's see there. This one.
Yes. And
Okay.
it to say lung.
No, lung.
Lung. Okay, lung. And rib. Oh, how
Rib.
is it?
Yeah, rib.
And diaphragm.
Diaphragm.
Diaphragm. Okay, diaphragm.
Yeah.
And for the it was okay.
Okay. Let me ask you something. This one.
Horizontal fissure of right lung.
Perfect. What about this?
Ligamentum arteriosum.
Yeah. Is that English or Latin?
It's Latin.
It sounds like Latin, right?
Yes.
As I was telling you yesterday during the presentation, you have the chance to check information in English and in Latin, mixing both of them. American books and British books of anatomical references, you have these mixing ideas in order for not repeating the same pronunciation and getting confused in the moment of studying. That's why you have these terms mixed, we can say.
Okay.
But that's great. Let's see this. Just this word.
I could say pleura.
Yeah, pleura. Like moving to an O, pleura. It sounds strange, right?
Yes, pleura. It's okay.
Yes, the pleura. Don't worry about it. We are going to check with more details some of these structures, and it's going to be easier to practice, okay?
Okay.
We start with systems tomorrow, and it's nice.
It's okay.
Okay, great. Okay, I send you the pool to take attendance, Vivian, so please fill this one.
Okay, teacher. It's okay. Bye, teacher. Thank you.
Okay, perfect. So see you tomorrow in the theoretical class, okay? Okay, bye. Hi, Stacy.
Hi, teacher.
Hi, how are you? How was your day?
A little busy, but
Okay.
it's okay.
Okay, perfect. Well, yesterday I introduced myself. Now it's your turn. Can you introduce yourself a little bit, please?
Okay, my name is Casey. I'm 22 years old.
Yeah.
And I finished my career of medicine the last year. And
Great.
now, yeah, and now I'm doing nothing because I have some problems with my documents or do my residence. So
Okay.
I'm
Did you
taking the
register?
course to do something.
But that's great. You have the chance to do it with all of the time that you really need to do it, right?
Yeah, yes.
That's great. Where are you from, Stacy?
I'm from Bolivia. I live in Santa Cruz.
Great. You are so young while finishing the career. That's great. A young
Yeah.
colleague. Yeah, great. But 22?
Yeah. I feel really happy because I finished in the 5 years and I don't lose any time, nothing. I do all fast.
Perfect. You never lost a semester or something like that, and that's great. It's amazing. There are few students who do that activity. Yeah, that's great. Yeah, but that's a good point of view. You have enough time to do as many things as you want. Use the time. Learn as much as you can. That's the best.
Yeah, I'm taking time to take some classes about different things to know a little more before to do my residence.
Okay, great. Let me see. Which specialty you are following?
For now, I really know. I'm thinking dermatology or epidemiology.
Great. Both of them are hard. So hard. Epidemiology is amazing, but maths are not for me in this case. Yeah.
Yeah, you have a lot of numbers and noise for all the persons.
Yeah, but that's great. That's great. Congrats. Really, really congrats.
Thank
So,
you.
let me ask Daisy, did you have the chance to check the slides from yesterday?
Sorry?
Did you have the chance, did you have enough time today to check the slides from yesterday? Because
Yes.
according to that information, we can work on this. Hello. Hello, can you hear me?
Yes, I was expecting if you will present the slides or something.
Yes, we can check this.
Yeah.
Yes, but do you have any question from them? Everything is great, it's clear maybe?
I want to and see if I really understand this part of illness, disease, and sickness, because I get a little confusion about that yesterday, and today I study a little more, but I'm not sure if the thing that I think is it true or not. So I understand that illness is when you know what is the thing that is happening, that you have the name. For example, you know that is dengue, and then you say it's an illness. But if you say disease, is it is that you didn't have clear what is. You have some ideas, but you aren't completely sure. And sickness is that affects your environment, and know the physiological or psychological thing. I'm not sure if is that correct or not.
Okay, let's clarify the idea. You have a general idea of these differences, but let's get it better, okay? Talking about the sickness, for example, when you get a common flu, do you make an appointment to the doctor? Do you go to the doctor when you get a common flu, I mean?
No, I can treat sometimes in home.
Yes, you try some, I don't know, some Tapsin, maybe hot tea, honey and lemon juice, and that's enough, right? And you get recovered from the sickness without any consequence at home by your own, right? So sickness, of course, makes you feel not so good. Your social life could be affected a little bit because you prefer to stay at home and relax than going outdoors, right? But you recover in few days without any specific treatment, just staying at home, relaxing, taking something that's so easy, and you can do it by your own without going to the doctor, right? That's a sickness.
Okay, so is something that you can create. You can do the treatment in home, and you don't have to go to the doctor necessarily. It's only you have. If only if you want, you can go to the doctor. But if you don't have to worry about it.
Yes, if you don't really need to go, you don't go because you know that you're going to be okay in some days, right? On the other hand, we have the illness. The illness is a situation when you, of course, you feel bad. You have a specific medical situation. For example, a gastroenteritis, you have a diarrhea, fever, and pain, right? You try to stay at home and take something natural maybe, but it doesn't work. And then you decide to go to the doctor. You make an appointment and go to the doctor. The doctor checks you up.
Yes.
physical exam and gets a diagnosis. He explains you that you are suffering from gastroenteritis, maybe. Starts treatment with antibiotics, maybe. And then, while finishing the treatment, you recover without any consequence, right?
Right. Okay.
That's an illness. It's an acute situation that can be solved without any consequences in a short period of time. A good example is a gastroenteritis. Okay?
Okay.
Maybe a non-complicated pneumonia could be because taking antibiotics, you get recovered without any consequence, right?
Right.
That's an illness. The disease, it's a
So,
situation. Yes. The disease is something that is going completely wrong. You make your appointment and the doctor who's evaluating you, maybe a general practitioner like us, decides to ask you to ask about this situation and a specialist, an expert on this kind of cases, right?
Right.
You need an extra opinion from something who has maybe more preparation to get the correct diagnosis. This specialist takes lab tests, some studies, some research about medical research, I mean, CT scan, X-rays, ultrasound, who knows, according to the situation, right? With all of the investigation that is done, he gets the support of the protocol of studies and then gives you the diagnosis. But with that support, labs and everything, and following his opinion, he gives you a diagnosis from a chronic situation, right? Could be a diabetes, for example.
Okay.
By
So the difference
diagnose
between all
diabetes, you need a lab report that is showing you the situation, right? Now, for ensure on this situation, you need to complete the protocol, the study protocol, and then with that, you can give a solution of this, right?
Right.
The solution is a treatment that is going to stay the rest of your life. You cannot leave this, okay? You must take your pills, take your insulin the rest of your life, and your physiological and psychological dysfunction is not going to change. Of course, your lifestyle is going to change completely. That's a disease.
Okay, now I got it. Thank
Now it's
you.
clear,
It's
right?
very different what I was thinking, but now I got that clear.
Okay, perfect. That's the fact, to be clear on this.
Yes.
If we're clear, let's see. Is COVID-19 illness or disease?
What?
COVID-19, our last pandemic times, illness or a disease? Which one do you choose?
I think that depends, in the case when the person have consequences to the future, like a dysfunctional problem with the pulmonary system, and that could be a disease. But if the person have the COVID and in the way that he didn't feel I lose the word, but that don't have consequences to the future, and I think that could be considered an illness because they can continue their life normally.
Yes, that's great. That's the answer. That's good. So you catch the, yes, you catch the idea. That's great.
Okay, so I got it. Thank you. I really need know the difference because I was doubt about if that was correct or not.
No, don't worry about it. Now you have the chance, right? So you got the meaning of this. In that way?
Yes, and that was the only thing that I have doubts. All the slides are very clear.
Yeah, start for practicing, right? For reading and catching the context in some cases, right? But that's the idea.
Exactly.
So catch this meaning is the best way to start working on.
Yes. So thank you and have a good night.
Hey, Stacy, I'm sending you the diary pool to take attendance. Please, let's fill this, okay?
Okay. Thank you.
Tomorrow we
Bye.
have our class and see you tomorrow, okay?
See you tomorrow.
Okay, bye-bye. Stacy, you didn't send me your pool. Stacy?
I'm doing it.
Oh, okay, perfect. I'm gonna expect. You're feeling this.
Okay. Bye.
Bye. Hi, Fernanda.
Sure, good night.
Good night, Fernanda. Can you hear me clearly?
Yes, teacher, I can hear you.
Okay, thank you. Do you prefer I call you Maria or Fernanda, or is that okay, just Fernanda?
Fernanda is good to me. Thank you.
Okay, perfect. Let's turn our videos a little bit on for meeting each other a little bit. Yesterday I introduced myself. Now I'd like you to introduce yourself. Is that okay for you?
Yes, it's okay. I'm on the street, so it's good to don't turn on the camera,
Yes.
or it's necessary.
No, it's not necessarily. You're on the street and it's not so safe. I mean, don't get
Yes.
worried. Let's introduce yourself.
Okay, my name is Fernanda Sologure. I am a doctor. I studied in La Paz, Bolivia, in Universidad Nuestra Señora de la Paz. And now I'm a doctor. I'm in Argentina, making some courses and making like my papers for duty residence here. And I work some days here and studied, made some classes, something like that.
That's
I
great.
think that's
So
all.
at this point, you are in Argentina.
Yes, I'm in Argentina just this month because I'm doing a course, and when the course finished, I'm going to come back to Bolivia. Like 1 month ago here.
Well, that's great. You are so brave to take this course being so far away.
Thank you, thank you.
Yes, so brave. Wow, that's a good way to start.
Thank you.
I didn't realize you were there, but great. Good point. Which specialty you are going?
I want to do surgery. It's the best that I want, but pediatric likes too. So I'm thinking about it. So maybe whatever can do it. You know, we need to do the exam, and maybe with
Yes.
the notes we are going to know.
Yes, I know how it works. It's not so easy to get on this. Right?
Yes, totally. Yes.
But that's great. Let's keep on working there, and I think we could reach your objective.
Thank you so much.
From Ecuador who is trying to go to Argentina too to make the residence course. And she's expecting on
Yes, Argentina is a good option. They have many places for good specialty, so it's a good place to do. But always you need to have people like your father or your family to send you any money for living, because if you live just with your residence work, it's going to be so hard. So hopefully I have my family can bring me
Yeah.
some money, and so that's perfect for me.
Yes, no, that's great. You're so brave, I mean. Wow. Well, great. So, Fernanda.
Yes, thank you.
There you are, far away. Yeah, far away. Let me see. Did you have the chance to see slides from yesterday?
Yes, I see the all the slides. I have a question about. I think each one there has like illness, disease, and other one. It's like the difference in these three. Yes, that.
This one, right?
Yes,
Yeah.
can you
Disease and
explain me a
sickness.
little bit more? Yes.
Yes, let's clarify. Did you catch the meanings maybe, or it's not clear?
This
So,
is, I know it's like pathology or something like uh, many symptoms that make something to you. I don't know, like a poke or I don't know, another one. And I don't know, illness and sickness. I don't know the difference. I don't understand.
okay, let's work on this. For example, with a sickness, if you get a common flu, do you make an appointment with the doctor?
No.
No, right?
No.
Take your vaccine, yeah. Your
Yeah.
medicine, take tea and lemon juice and honey, and that's enough, right?
Yes.
You recover without any trouble, and in a few days you feel great. You
Yes.
treat yourself at home, right? No medication.
Yeah.
That's a sickness, a very easy situation that, of course, can make you feel worse in some days. You recover without any trouble, without something too complicated.
And you don't use any medications in this case.
Yes, not a treatment that is prescribed by a doctor, right?
Yes, but can be a health check and you take some ibuprofen and that's an illness too.
Yeah, some painkillers, and that's enough for sickness. In an illness, for example, you get fever, diarrhea, and abdominal pain. At the beginning, you say, okay, I'm gonna stay at home, take natural medicine, yeah, my matecito, my coca tea, yeah. But it doesn't work. You feel worse, and you decide to go to the doctor. You make an appointment, or you go to the emergency department. You get evaluated to in the emergency room. The doctor makes a physical exam, but doesn't really need a treatment. Doesn't really need not a treatment. Doesn't really need a lab test. I mean, because with the findings the doctor has, decides and gives you the diagnosis of a gastroenteritis, right? Then the doctor gives you treatment. You complete your meals, your antibiotics maybe. But when you finish your treatment, you feel great. You recovered without any consequence. You get back to previous life. That's an illness, an situation. That's a pathological situation with a treatment without a consequence, and you feel great while finishing this. Okay? On the other hand, we have the disease. The disease could be called a chronic situation. When you really need the opinion from an expert, maybe a specialist. Okay?
Yeah.
Example, the same case, you start with diarrhea, dehydration, and go to the emergency room. The doctor who checks you at the beginning says that something is not clear and decides to ask about lab tests. He receives the reports, but he sees that something is going completely wrong. He decides to call the specialist. The specialist checks the results and decides to complete the lab studies, image studies according to the situation, right? And then the doctor, the specialist, the expert following the protocol of assistance, I mean, gives you a diagnosis. But with this diagnosis, you receive the bad news that it's a chronic situation, for example, a diabetes, right? Everything in your life is going to change. Your lifestyle completely changes because you need a treatment every day, all the time, because of the consequences you might have if you don't take it. Hi.
In a one disease, you can, I don't know how to say it. You need to internation, or you can do it ambulatory.
Could be ambulatory.
It's the same. Yeah. Okay.
Yes. It's according to the protocol of assistance the specialist is following. For example, in diabetes, not always you get admitted into the hospital, right? You could be admitted or not, according to the situation.
Okay, I understand.
Arthritis rheumatoidea. You get admitted or not?
You don't get admitted, but if you have some
to-
complications, maybe.
Yes, if you're in chronic, in extreme pain, maybe you get admitted because of control of pain, but not for controlling the arthritis, right? That's
Yes,
why.
exactly.
Yes, according to the situation, you decide if the patient gets admitted into the hospital or not.
Exactly.
That's why a disease could be diagnosed in an ambulatory attention or admitted into the hospital.
Okay, I understand. Thank you.
It doesn't matter. It's according to the protocol, but the difference is that a disease could be called a chronic situation because your physiological dysfunction is not going to recover. It's going to stay the rest of your life with you.
And you need a treatment all the time.
The rest of your life, you must be on treatment. If you leave your pills, your shots, well, the things you need, of course, the situation is getting worse. It's relapsing, right?
Yes.
You can get it under remission, but not recovered. Hello, I'm sorry.
Yes, I understand.
Okay, is that clear now?
Yes, it's clear to me.
Perfect. For example, if I talk to you about, I don't know, COVID-19, it's an illness or is it a disease?
Yes, it's clear to me too.
I'm sorry, I couldn't understand you so clear. There are a little bit of noise. Hi, Fernanda.
Yes, sorry, teacher.
Don't worry about it. How could you classify COVID-19 as an illness or as a disease?
Can be an illness because it's not a long time.
Okay, could be an illness, right? If there's no consequences about this situation, you can say this is an illness. But what about the post-COVID syndrome?
Can be a disease because it's chronic and you have something in your lungs, or you can breathe like good or something like that.
Or maybe chronic pain just, right?
Yes.
That's why these ideas about illness and disease are dynamic concepts, dynamic ideas. You can become with an illness like COVID, but finish with a disease like the post-COVID syndrome, right?
Yes.
Or maybe you can start with a parental disease, but actually it's an illness. For example, a pneumonia with a patient that gets admitted in the intensive care unit. If the treatment is effective and the body supports all the treatment, it's an illness because you could recover without consequences.
Yes.
That's why it's in the situation, you decide if it's an illness or a disease. Okay?
Okay, perfect.
Okay. Any other question, maybe?
No, I'm good enough with just one. And I want to know, admission is the name for the internation. And how's the name for cuando lo dan de alta,
Yeah.
egrese,
Yes, discharge.
discharge? Okay.
Yes, let me write it down by the chat.
By the chat, please. Mhm. I don't see it.
There's
Okay. Mhm. Admission es ingreso al hospital y discharge.
No,
is
discharge.
the other one. Discharge. Okay.
Yes.
Perfect. Thank you, teacher.
Okay, there are concepts that we are going to check in some at the end of this model, but that's okay. That's great. Yeah, we are one step ahead.
Okay. It's good to me. Thank you so much, teacher.
It's gonna be useful. Let me send you the pool to take attendance. Can you watch the pool? I don't think so.
No, I can see.
Okay, let me relaunch it.
Okay.
Okay,
Ahora sí.
perfect. Let's fill this, okay?
Ahora lo estoy haciendo. Okay, it's ready. Thank you, teacher.
Okay, perfect, Fernanda. So keep on reading and see you tomorrow in the theoretical class, okay?
Okay, thank you, teacher. See you tomorrow.
Okay, bye-bye. Hi, Natalie. Hi, how are you? How was your day? Nice
I
to
think
see
okay.
you.
Nice to see
Great.
you too.
Thank you so much. So yesterday I introduced myself. Now is your turn. Can you introduce yourself, please?
Yeah, sure. My name is Natalia Viles. I actually study at Universidad Mayor de San Andrés. I'm
Oh, great.
studying veterinary.
Veterinary vet. So brave. Because that's far away from human medicine.
And I'm 22 years old. Sooner I'll be 23. And I'm here with my dad. I think he was the first in this class.
Ah, okay. Neil. Okay, he's your dad. Okay, I have a daughter and dad. Great. Great. You couple decide to take this course.
Yeah.
Great, great. Your father is a dentist, right?
Yes.
Yes, I reminded you. Oh, that's great. How you decided to take it together? I mean, it's not common to check this situation.
Yeah. My mom live in Florida, in Jacksonville. So I was thinking to go there for a pasantee, I think it is called. And
Yes,
so I need
to, right? Yes, you really need to improve this area. But well, this course is designed for doctors, I mean. We can try to fit it in order to work with vets. Okay.
I will be a doctor on November, I hope. I have to defend my thesis, so yeah.
Okay. Oh, that's great. And you were so young. That's the best part. You didn't waste time doing crazy things. But that's great. But a vet, so brave. Vets is harder than human medicine. You have lots of things to do that are different, extremely different. In a previous group, I had a vet, a doctor, who used to talk to me about her clinical situations, and I get mad because I never realized that kind of health health problems in animals.
Yeah, it's
I said how
it's
it really
similar.
works.
It's similar, but in a lot of things, it's the same.
Yes, I never
They
realized
have
a dog could have cancer like a human, and I said, "What's going on with this?"
yeah.
It sounds not so good. Yeah, what's happening? We are.
Alimentation, nutrition, I guess.
Yes, maybe nutrition.
Mhm.
Well, but it happens. That's great to meet you. So let's try to fit this course in order to follow the objectives you really need according to your career, okay?
Okay.
I think it's going to be useful. It's going to be possible to make it, okay?
I think it's it.
Yes, you told me your mother lives in USA, right? In Jacksonville.
Yeah.
What does she do? Jacksonville.
Uh-huh. She is I don't know how to say this. She works in the house of other people, cleaning.
Housekeeper could be?
Housekeeper.
Oh, perfect. But that's a good activity at this point. At this moment, it's a safe job.
Yeah.
It's safe. It's possible to work in that way and, of course, make money.
Uh-huh.
Okay, great. So, Natalie, let me see. While going to USA, do you plan to work there? I mean,
I'm not planning to work there, but I'm planning to get some courses.
Okay.
Mm-hmm.
Okay. I'm asking for this in order to organize a little bit the information you might need and fix and feed maybe homeworks or maybe details that are going to be useful for you while staying there. Okay.
Okay.
So we have lots of jobs to do. Here I have engineers, lots of students. Now I bet perfect, but that's great. That's the idea. So let me see. Did you have the chance to check the slides from yesterday?
Yes.
Perfect. Let me share the screen. Do you have any specific question, a detail to talk about?
Yeah, it's exactly that. I can't understand the difference between sickness and illness.
Okay, sickness and illness is the fact, right? Okay, let's do this. Explain to me the idea you got about them, all of them.
As I understood, disease is something that, how it says here is wrong with your body function. But as I understand it, it's enfermedad.
Well, in Spanish we say that you are enfermo o sano, and it's easy.
Yeah.
But in English, you have the chance to classify between sickness, illness, and disease when you talk about enfermedad. Three of them, the meaning of them is enfermedad or enfermo. But what's the difference in context? What do you do them?
I think illness can be treated. It has a solution, but disease, no.
Yeah, doesn't have a solution.
It's a palliative treatment.
Yeah.
It can be worse.
Yeah.
It's something that doesn't have cure at all.
Perfect. Yeah, you have the idea. What about sickness?
I don't understand sickness. I mean, that's like a flu.
Yes, perfect.
Yeah?
Yes, a common flu is the best example. For example, let me explain to you. When you get a common flu, do you make an appointment to a doctor?
No.
No, you take your medicine plus, take your test, and that's enough, right? Get better, you recovered in some days, in a few days, and you can continue with your life without any trouble.
Yeah.
Of course, the days you are with the symptoms, with fever, pain, something like that, you decide to stay at home, and your social life could be a little affected, but nothing important, right? Crucial. You can go back to your previous life without any trouble.
Yeah.
In an illness, for example, you start with a diarrhea, abdominal pain, fever. At the beginning, you say, okay, let's take coca tea, but it doesn't work. And then you decide to go to the doctor. Doctor checks you up, makes the physical evaluation, the physical exam. And the doctor says that certainly you have a gastroenteritis. He didn't take lab tests, extra studies, nothing so complicated. Maybe the basics for being sure, and that's enough. He gives you the treatment with pills, and that's enough. You take your treatment, and in around 7, maybe 14 days, you get recovered and you go back to your previous life without a consequence. You got with an infection, but you have a treatment, you have a cure, and there are no consequences, right? That's an illness. In a disease, you start with diarrhea, you go to the doctor, make an appointment, the basics says you have something not so clear, the lab tests, I mean, and the doctor decides to refer you to a specialist because something is going wrong. The specialist, the expert, evaluates you again, makes the physical exam again, and he decides to ask for more specific lab tests, more specific investigation. According to that, following a protocol of diagnosis and treatment, he gives you a specific diagnosis. In this case, I don't know, diabetes, for example. With that diagnosis, you must realize that there is no cure. There is a treatment for controlling the situation, for getting under remission, but there is no cure. The rest of your life, you are going to stay taking pills, receiving medication, receiving shots, I don't know, according to the situation you are at the moment, right? And everything in your lifestyle changes. Your diet, your routines, nothing is going to be as in the previous period of time, right? That's a disease, a chronic situation.
Okay.
Is that clear now?
Yeah.
Perfect. So if I ask you, well, the popular one, what about COVID? Is that an illness or a disease? What do you think?
I would say it's an illness.
Why?
But it depends on the grade.
Okay.
Because I think the COVID, it's more common now. Maybe at the beginning, it was a disease. Then with past of time, it becomes an illness. And now it's like a sickness, but it depends on the symptoms.
Yes, it depends on the real situation, right? We have situations when COVID has no symptoms, asymptomatic infection, right? That could be a sickness, maybe headache, and that's enough. We said it's a common flu, but no, it was COVID.
Yeah.
It would be treated as a sickness. It becomes an illness if COVID doesn't leave any consequence. But if it leaves some consequences like losing taste or smell or chronic pain, that could be a disease, right? That's according to the situation. That's great. You catch the idea.
Yeah. Thank you.
That's a good point. Is that clear? These concepts, this classification, these definitions?
Yeah, it's clear.
Perfect. I ask for these differences in context because while reading articles for becoming up to date, Of course, you have these ideas indeed in context, not clarified, of course.
Mhm.
In articles, in reviews, you are going to check situations that are described as an illness or a disease commonly, and some of them as a sickness. So catching these meanings, it's easier to get this information properly.
Yeah.
Okay, any other question maybe?
Yeah, it was when someone is cured at all, but then get worse again, and again, how is it
relapse?
Go relapsed, but in a sentence?
For example, my brother had tuberculosis last year. He took medication and he was going in a good way, but now he relapsed.
Okay.
Okay. Is that possible to make, right?
Okay. And for remission, it's something that someone get worse constantly?
No, for example, with arthritis, you get that joint inflammation, chronic inflammation, right? You take your pills, and these pills are going to be effective in order you continuously take this, right? If you leave them, are going effective, there is no inflammation, no pain, the arthritis is on remission, is under control.
Okay.
If you leave the medication, you get relapsed. And again, the pain comes back, and well, it's not an easy situation.
Okay, I got it.
Great. Natalie, I send you the pool to take attendance.
Okay.
Great. So let's fill this, and great. Thank you so much.
Thank you.
Okay, great. See you tomorrow in the theoretical class. Okay, Natalie?
Good night, teacher. See you tomorrow.
Good night. Hi, Melissa.
Hi, teacher. Good night.
Good night. How are you? How was your day?
I'm fine, thank you. Was a little bit moved, but fine.
Oh, well, that's our kind of life, right?
Yeah, just give me 1 second and then we'll.
Yes. Let me see, Melissa. Can you turn on your camera a little bit for meeting each other, I think?
Yeah.
Thank you.
Thank you.
Okay, can you introduce yourself a little bit, please, for meeting each other? I mean, I did it yesterday. Now it's your turn.
Sure. Well, my name is Melissa. I'm from La Paz. I live here in La Paz. I'm a general doctor, a general physician. I work in a private consultation.
Yeah.
And I'm also a mother recently.
Great. Congrats.
10 months baby.
Oh, great.
I think that's it.
Oh, but that's great. You have a kid, girl or boy?
Girl.
Oh, great. Your little best friend.
Yeah.
I have a teenager, a boy.
Oh.
Then I have 2 babies. One has 2 years. The second one has 1 year. And my third baby is gonna born on July.
Oh, wow.
Yes, I'm so big now, but well, patience. I'm safe. I'm comfortable here. Yeah.
My baby born in July 8th.
Wow. Well, I hope we can finish the model 2 and my baby borns after that.
Yeah.
I hope so. I'm crossing fingers for that time. Okay. Okay, Melissa, that's nice. Let me ask you something. Fernanda, are you our relatives?
Yeah, she's my sister.
Great. I read same last name. They are sister or something like that. But that's
Yeah,
great.
she's my sister. She's also a doctor.
Yes, but that's great. But you are a family of doctors. That's great.
Well, we're just two.
Not bad. But you have the support of your friend, of your sister, I think, and it's a good
Yeah.
way to start working on.
Yes.
Yes, you have someone who understands your lifestyle.
Yes.
And it's very hard to find, right?
Yeah, that's correct. Yes.
Yes, but that's amazing. So Melissa, that's great. Your kid is sleeping, is awake.
It just get sleep, I think.
Oh, okay, let's cross fingers.
Yeah.
Okay, now my husband is with my two babies and they are having fun, I think. I don't know. I don't want to go there. He has to work with them now. It's his duty.
Yeah, we're in the same. He is with my husband right now. Hopefully just get sleep.
Hopefully,
He was
let's
trying to get sleep, but I hope so.
Yes, that's great. Okay, Melissa, that's perfect. That's a good way to start. Let me see. Did you have enough time to check the slides from yesterday?
Not really. I tried to. I checked like very quickly, but I didn't take it like for memory.
Okay, don't worry about it. I ask you that because every workshop, we have the chance to check all the doubts you have from the whole week. I mean, if you didn't have enough time to check the slides today, because on duty with a kid and job, it's not easy to do it. And if you prefer to work on Thursday, we can do this. On the workshop now, we can fix, I don't know, pronunciation, grammar rules, well, small details, different details than specific contents from the slides.
Okay.
Just try not to get too much information to check in just one workshop because 15 minutes might not be enough at the moment to be there, okay?
Okay.
So there are some specific details that at this point I'd like to check with you. But if you prefer, we can do it on Thursday if they are not so clear, okay?
Okay.
All right. Can you watch my screen?
Yes.
Yes, my screen doesn't want to work, yeah. Okay, this is the slide. Did you get the difference between this classification, we can say?
Yes, I got it yesterday. Like sickness is like something like easy, and then illness is something more acute, and this is something more like chronic.
Okay, if I ask you about an example of each one, which pathologies you might choose?
Disease, I can say like diabetes.
Yes, the example of the presentation could be.
I'm not sure if illness will be flu.
Okay, and the sickness?
Like abdominal pain.
Yes, could be abdominal pain, could be something that you treat at home without a specific medication, without a treatment that is prescribed, without a prescription, right?
Could be flu as well, and the illness, it could be like respiratory tract infection.
Yes,
maybe
could be.
Antibiotic, and sickness just a common flu.
Yes, a common flu, that's great. You catch the point. These ideas are classified in English medical terms in order to organize how to refer information, how to give information to our patients, to our colleagues, and how to treat the research, I mean, how to understand the meaning of articles. Usually while reading, I don't know, an article, a journal, you might find these two concepts, indeed, the general ideas. But getting clear these definitions, it's going to be easy to understand and to catch the correct point, the fact of the article, okay? That's the objective of this. And you have the right illness, no consequences, an acute situation, and your life goes back without any problem. A disease, a chronic situation that really needs a treatment the rest of your life and everything changes. Diabetes is the best example because you know that if you don't take your pills, the consequences are awful, right? That's the way that patients understand. If you don't take it, yeah, you become blind. And they say, what? Yeah. And they become with discipline to continue this, right?
Yes.
Oh, okay, from the slides you were checking, do you have any question?
No, I think I'm clear with these terms now.
Okay.
I didn't know that.
Hey, great. In that way, check the slides, check the information, maybe pronunciation from the anatomical landmarks, the superficial anatomical details, I mean. Let's see some of them now. And the inner organs. Some details, they're just a general presentation, just the basics at this point. Okay, this guy. With this basic idea, you have the chance to continue reading and, well, let's keep on practicing. From this chart, is that clear how it works, right? In black and white,
Yes,
the
I
Latin
think it's like Latin and then like normal or term how you like normally say, and then medical term.
Yes, the common term and the medical term. While writing down a medical report that we are going to make during this course, use the Latin or the medical term. There is no trouble on this. The common term just for talking to patients, okay?
Okay.
Well, there's some expressions, I think. Some phrasal verbs, always phrasal verbs, how I hate them. They make us get in confusion, right?
Yeah.
And the inner organs, well, cavities and organs, just a general review, because from tomorrow we are going to start checking system by system and of course more details. The general ones, of course, there is not too much time to check in the way that sometimes we expect, but we have to make our best. Is the easiest. Well, these body functions, these processes with the specific verbs to check maybe. I think it's all. And this words, the function, the verb and noun, that is very, I think, important to get the difference while talking and getting into context, right?
Yes.
No more than that. So, any question? If there is no questions about it, there is no trouble for me, but check them, okay?
Okay, will do.
Sometimes, well, it happens with previous groups. Students couldn't catch some meanings or have another functions to develop. We can talk about it during the workshop and get more functions, okay? There are the general ones that are into the basic book, the one that I used for preparing the material, but if you have some more questions, it's better.
Okay, I will check it and write if I have some question.
Yes, if there is something extra, well, some maybe a question that we couldn't solve during the 2 workshops of the week, we can talk by WhatsApp and then solve the doubt, okay?
Perfect.
Okay, so I send you the pool for taking attendance.
Okay, just take it.
Okay, thank you so much, Melissa.
Thank you, teacher. Have a
Great
good night.
night.
You too.
Try to
Bye.
relax with the babies. Not so easy.
Yeah, thank you. Bye.
Bye. See you tomorrow in the theoretical class, okay?
See you. Bye.
Okay, bye. Hi, Miriam.
Hi, teacher. Hello.
Hi, how are you?
Fine. Thank you.
Okay, let me open my video. Let's meet each other. How are you? How was your day?
My day is very busy today. I work, I study, and care my children.
Okay, so you have kids?
2 kids.
Okay, great. How many kids do you have?
2, and girl and boy.
A couple. Great.
Yes.
Oh, that's amazing. That's great. That's a good point. So you're a busy mom, doctor mom.
Yeah, I'm nurse.
You're a nurse. Great.
Yes, I'm nurse.
But it's harder to be a nurse than a doctor. You have lots of activities to do in a short period.
The time is busy.
Yes, I really admire your profession because it's not easy to make. It's so hard. Oops,
Yeah.
you're out of sound. Okay. At this point, well, checking myself, I recognize I cannot be a nurse. It's out of my hands. I have to be so clear on this. But that's great. So brave, Maria, so brave. Nursing is not easy.
No, it's not easy. The time is not, I don't know, suficiente. Is
yes, it's not enough, right?
Enough. It's not enough of time. It's say in morning in what's it?
In the morning, well, in the shift.
The morning begin in the 5 o'clock, in the night end of 11, in the middle night.
Yes, you have a time to start your activity, I mean, but you don't have a time while finishing, right? You have to rush all the time.
All the time, yes, that's correct.
Yes, it's not easy. Okay, Maria, where are you from?
I'm from Mexico. I live in Tamaulipas.
Okay, great. Well, that's one of my objectives was to go for a study into Mexico, but well, I decided to get kids. And everything changes when you have kids, right?
The kids is a lot of work.
Yes, too much work. Well, actually, I have a teenager. Is my biggest boy.
It's more work.
Yes, it's hardest. But actually, I have 2 babies. One of them is 2 years old. The second one is 1 year old. And the third one is gonna born in 2 months, I think. I hope.
Oh, the babies is
they are girls.
Twins.
Almost twins. They are a short difference. One was planned, the first one, but the second and the third, I'm more surprises. They told me, they told me, I want to go and I'm here and you don't have any way to tell us that we are not coming. And I said, okay.
The other one, again, other one. Me
yes,
too, my children have a little different of age.
Yeah.
It's the
them.
same way, twins.
Yes, they grew up as twins, right? Well, now my kids are going to grow up as triplets. But patience, patience. That's great.
No,
Here in La Paz, we have a musical instrument that are like scales. It's a zampoña. They are my zampoñas.
What is a zampoña?
Zampoña is a windy instrument, a musical instrument that are like scales, like steps. Because there's one.
Is the same for the flute?
It's similar to a flute, a pan flute.
Okay. Yes.
Okay, it's similar to that because they are organized in steps. The biggest, the middle, and the third, maybe the fourth. And here in La Paz, they say zampoña. They are my zampoñas.
I never heard this
No, it's a Bolivian musical instrument, and it's nice because when you see kids that are so close, like in my case, they are called sapoñas. It's a ganja
Oh.
from the word. It's very
Oh.
okay, Maria.
Yes.
So let me see. According to your time, today was a busy day, you told me, right? So did you have enough time to check the slides?
Yes. Maybe I change the half presentation.
Okay, don't worry about it. Do you have any questions, something you would like to check again, maybe?
Yes, I have question in the different for the
Let me get
by the question.
this one, right?
This one, yes. Yes, is the question. What is the different the islands is for symptoms or I don't know.
Okay, let's talk about it. When we consider illness, disease, and sickness, is the way that in medical terms, in English medical terms, we classify the enfermedad. In Spanish, we say enfermedad, and that's enough, right? Yo estoy enfermo. But in English, you have the chance to make a difference between how ill, how sick you are. When we talk about a sickness, it's something that you can treat by yourself at home without a specific medication. I mean, when you get a common flu, do you go to the doctor? You make an appointment?
No, really take a tea or only it's a tea or maybe rest sometimes.
Yes, you rest, take some tea, maybe paracetamol, and that's enough, right? You know that you are going to recover in a few days. There's no any other problem, right? Everything is under your own control. Sickness is to solve at home without any trouble. When you get sickness, for example, you start with abdominal pain, diarrhea, and fever. You don't feel as good as in a sickness. You decide to go to make an appointment to a doctor, right? Someone to get you into an evaluation, a physical exam, and you expect medication. With an illness, for example, you start with fever, pain, and diarrhea, abdominal pain. You go to the doctor makes the evaluation, and he tells you that your diagnosis is a gastroenteritis. Maybe take some lab tests, the basic ones for being sure about the situation. But he says there is no way to get upset, no reason to get admitted into the hospital. He gives you some pills, some antibiotics, and discharge you home, send you home to take your treatment. And in some days, maybe 7 to 10 days, you get recovered without any consequence.
Okay, right? It's a short islands, it's a short symptoms.
Yes, it's a short treatment. You have symptoms like fever, like pain, diarrhea, vomiting. Well, I don't know, many symptoms.
Transitory.
But they are not so bad. You can control them with the medication that the doctor is prescribing to you. You make your treatment and you recover without any consequence. There are no troubles on this. You get back to your previous life, you continue with your normal lifestyle, and there is no other consequence, we can say.
Okay.
You finish your treatment and that's all. You don't need more pills. It's just for that short period of time. Okay? And now we have the disease. The disease is something that is wrong in your body function. I mean, something that is not working properly. For example, you start with just with abdominal pain and diarrhea and dehydration. You go to the emergency room, the doctor makes an evaluation and takes some labs, some blood tests.
Hearing disease is a chronic.
Yes, it could be a chronic
Situation.
situation. The first doctor checks the lab tests, calls the specialist to evaluate you again, and the specialist, the expert, takes more studies. And according to the studies, he can give you a diagnosis. In this case, could be, I don't know, a diabetes, for example. You know that you need a treatment for the rest of your life. You cannot leave the treatment, and you have consequences if you leave this. There is no cure. It's a chronic situation, okay? Illness and acute situation. This is a chronic situation without a cure, without a solution. You can control the situation, but you cannot solve this. Your lifestyle is going to change. Physiological and psychological environment, we can say, is going to be different from this point ahead. Okay?
Okay. Yes.
Is that clear now?
It's clear. Yes.
Perfect. So let me ask you something. If we talk about, I don't know, tuberculosis, for example, is that illness, disease, sickness? How you might classify this?
It's a disease.
Tuberculosis, okay, could be a disease. Why a disease?
Because tratamiento, no sé cómo se dice, tratamiento.
The treatment?
The treatment is for long time.
Yes, it's a long period of time. What else? Do you have consequences when you get tuberculosis?
Yes, I have. They have pulmonary design. No.
Yes, could be a pulmonary dysfunction, maybe fibrosis, right? Maybe fibrosis. If you don't have the, I don't know, good habits on foods, on alimentation, or nutrition. If you get another kind of infections, maybe it could be a disease. For example, if you have non-pulmonary tuberculosis, for example, the bone tuberculosis is the Pott's disease, right?
Yes.
So it's a disease. When you have the kidney tuberculosis, it's a disease. You cannot solve the situation completely. You only treat the consequences of this. Right?
Okay.
Okay, is that clear now, right?
Yes, it's clear.
What about COVID-19? Is that an illness or a disease?
I say illness.
Illness.
But illness.
No. Illness.
Illness.
Yes, illness.
Illness.
Yeah.
Illness. Yeah. I think I say illness, but the COVID have a consequence.
Okay. COVID, at this point, we know it could be treated as an illness with a short treatment and expecting not for complications, right?
Yes, that's right.
But if we get some complications, it becomes a disease. For example, the post-COVID syndrome.
Okay.
In that point, I mean that between illness and disease, it's a dynamic concept, and it can change from disease to an illness or from illness to a disease according to the situation and the consequences we live with the patient. Okay?
Okay.
So it could be, is that clear now, or maybe it's not so clear?
No, it's clean now.
Okay, perfect, Maria. Any other question, maybe?
No, only I need check the vocabulary for the last ¿cómo se llama? Graphic.
Yes, from the slides, from the anatomical landmarks. Check all the vocabulary.
The vocabulary where they say in the related remission.
Okay. Relapse, remission, and recover.
Recover. Mm-hmm. I
Okay.
need to check this one. This.
Yeah. Okay, this one, right?
Yes.
Recovery.
Recovery is when.
Yeah, tell me, I can hear you.
Yeah, recovery is when the patient return. I say the return to the normally health.
Yeah.
After is when the patient is good.
Yes. It goes back to the previous state in life without consequences. The same example with the illness. You take the pills for the gastroenteritis, you feel better, you feel good, you recovered, and there is no consequences. You can go back to the lifestyle.
They don't need any more care.
Yes, no more treatment, no more controls, everything is done.
Treatment. Okay. Relapse is.
Yes, relapse, right?
If the patient is better but gets worse again, he has a relapse. Relapse is for, I don't know, for the continue to
yes,
care.
Going back to the symptoms. For example, with the diarrhea, you start your treatment. The first days of the treatment, you feel better. There is no pain, no diarrhea, but suddenly the diarrhea comes back again and you feel bad again. The pain comes back, the fever comes back, you relapse because the treatment is not working.
I need more
maybe more studies, or maybe change the treatment because the one that you're doing is not working. You were improving, you were better, but something is going wrong, and then you get back to the previous state, and again you are worse. You feel bad, you have fever, pain, diarrhea, and the treatment is not working. You relapse in that case.
Okay, I need more treatment.
Yes, you need a specific treatment of this.
Okay.
You need to change it to try to recover, right?
Yeah. Yes, I got it.
Perfect. About remission?
Remission, relapsing. Remission is for the in current condition is no more. Is no more. The illness, the disease is enough.
Okay, let's clarify this. For example, you have arthritis, right? It has arthritis, and we know that it's a chronic situation because needs pills the rest of her life, painkillers, right? But the patient decides to leave the medication away because he's tired of this, and the pain comes back, and the inflammation in joints comes back. Goes to the evaluation again, starts the treatment again, and all the symptoms are again under control, are under remission. The situation is controlled, but it's not solved, it's not for cure.
Okay.
Okay?
Yes, remission of is the end on the disease.
Yes, is that the state, that moment in the disease when you are without symptoms, but you still need the medication.
Okay, teacher.
For example, in epilepsy, you take your treatment for not suffering the convulsions, right? The seizures. You need a period of time with medication for not relapse with the convulsions. For example, 5 months without convulsions with treatment is the criteria to take away the treatment because the epilepsy is on remission. You don't need the treatment because you don't have the risk to go back to convulsion. That period when the chronic pathology is under control. Could be with treatment or not. It depends on the situation.
Okay.
Is that clear?
Yes, teacher. I got it. This.
Perfect. Maybe another question?
No, that's all. Hasta ahí voy.
Great. Great. At this point, that's all.
Yes, that's all.
Okay, perfect. Let me send you the pool to take attendance, okay?
Yes, teacher. Ready.
Perfect. Thank you so much.
Thank you, teacher.
Mariam. Let's meet tomorrow in the theoretical class, okay?
Yes, teacher. See you tomorrow.
Okay, see you tomorrow. Have a great night.
Happy
Bye-bye.
night. Bye.
Bye. Okay. At this point, I'm expecting Paul Vallejos. He's a little bit late, but let's wait. Let's wait a little bit. He might get into. I called Stacy because she didn't send me the pool. So let's wait a little bit. She must come to get it into solution. Until this point, let's fill the attendance. Yes, yes, yes. Yes. Bye. Let's wait a little bit. Okay, Stacy. Stacy, thank you for coming back. Let me send you the pool to fill this again, okay? I didn't receive this.
Okay, I don't know why this didn't send, but I did it.
Sometimes it happens because of the internet disturbances we might have. Here in La Paz is windy, so maybe because of that I didn't receive the answer.
Yes, could be. I sent it.
Yes, I got it. Thank you so much. Thanks for coming back.
Welcome. Welcome, don't worry.
Okay, see you tomorrow. Bye-bye.
See you tomorrow. Bye.
Okay, perfect. Now let's wait for Paul. And let me send a message to Liz. Okay, I send a message to Liz in that way. She might get into the class. And then let's check this. Well, at this point, I'm expecting Paul Ernesto Vallejos. Yesterday he told me that the schedule was fine for him, but now I have no answer. And I sent a message to Liz Giselle. She told me she might come back and take the attendance to the workshop, but at this point we don't have this opportunity. So let's wait 5 minutes more. If they don't attend, I'm gonna close this. I'll be back. Okay. Let me share the attendance. Yeah. Well, first of all, we finished the workshop. We finished all the activities and everything is done. This is the WhatsApp group. And this is the role we were working on tonight. Liz Giselle was supposed to get at 7:15, but she told me she messed up with the schedule. We get in touch by WhatsApp, and she told me that she could come back at the end. I sent her a message. She's not attending this, so let's wait 3 minutes more, and that's enough. Then Misael, he did not attend. He came to the class at 8 maybe or something like that, but he didn't come back. He didn't tell me anything. I'm gonna send him a message to correct the situation. And Paul Ernesto Vallejos, he told me yesterday that the schedule was okay, but he's not attending, so it's over. Now it's 11:10. The workshop is over. I finished this. I'm exhausted. I decided to wait for Liz because I understand that she could get a little confused at the beginning because of the change of time. But now it's not possible to understand this. So I sent her a message. We were talking about it by WhatsApp. She didn't attend it. It's not my business. I'm gonna close this. So let me close this. Everything is done. The activity is over. See you tomorrow in the theoretical class. Goodbye.